And we should be all set.
Good morning. I'm Jeb Bradley from Senate District 3. Today we are holding a meeting of the Senate Health and Human Services Committee. Before we get started, I will read through the checklist to ensure that this meeting that we are holding is in compliance with the right to know law. As chair of Senate Health and Human Services Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note, there is no physical location to observe and to listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that, number one, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access to contemporaneously watch and or listen to the meeting on Zoom or YouTube and via phone by following the directions and links provided on the General Court website. 2, we have provided public notice of the necessary information for accessing the meeting in the Senate calendar. 3, we are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remote senate, that's one word, remote senate at leg.state.nh.us, or you may call 603-271-6931. 4, in the event the public is unable to access the meeting, it will be adjourned and rescheduled. 5, please note all votes taken during the meeting shall be done by roll call vote. And finally, let's start this meeting by taking a roll call attendance. When each member states their presence in the meeting, please also state where you are and if anyone else is in the room with you during this meeting, all of which is required under the right to know law. So I will start with the roll. We'll start with Senator Gray.
Hi, this is
I caught you raising your coffee cup.
That's okay. That's okay. It's got hot chocolate in it, you know.
There you go.
This is Senator Gray. I'm at my home in Rochester, and I'm alone in this room.
Senator Sherman.
Senator Sherman, I'm at my home in Rye, and I'm alone.
Senator Whitley.
Good morning. This is Senator Whitley at my home in Hopkinton, and my family is in the house, but I'm alone in the room.
Senator Avard.
Senator Avard here in my office in Nashua. I've got a barking dog, a loud cat, and a couple of other people in the house, but I'm alone in my room.
And it's Jeb Bradley in Wolfboro, and I am alone in the room. Okay, so having dispensed with the right to know script, I'm going to open the hearing on Senate Bill 156. My understanding is that Senator French is not able to testify this morning, but that Josh Elliott, our policy director, deputy chief of staff, is prepared to testify for Senator French. So good morning, Josh.
Good morning, Senator Bradley. Members of the committee, for the record, my name is Josh Elliott. I'm the Deputy Chief of Staff here for the State Senate. I'm here on behalf of Senator French to introduce his Senate Bill 156, an act relative to the management of the secure psychiatric facility at New Hampshire Hospital. The bill analysis: this bill declares that the management of the new secure psychiatric unit facility shall be the responsibility of the Department of Health and Human Services. Under this bill, the department shall not enter into a contract for the construction or operation of the facility with a private for-profit prison construction or management company. With that, I'll conclude my testimony and ask that any questions be deferred to those who are going to testify after me.
Are there any questions of Josh? And I don't think there will be because of the way he deferred. So thank you very much, Josh.
Thank you, Senator.
So Kirsten Griffin, who
Yep.
is next?
So our first person wanting to testify is Wanda.
DeRay. Good morning.
Hello, my name is Wanda Duryea.
Good morning. How are you, ma'am?
I'm doing well, and you guys?
Good.
So I've been advocating for removing the civilly committed, non-convicted men and women from the state prison for men secure psychiatric unit for about 5 years now. I've spoken before some of you and have had many conversations with legislators regarding the civil rights violations and maltreatments of individuals in the SPU. We've brought patients' families before the legislature who have alleged that the family members have been raped, tasered, locked in solitary, pepper sprayed. One person pulled all 10 fingernails out while on suicide watch. Another had their toenails grow so long that they cut into the soles of their feet. Women have been denied feminine products, and many have been denied toilet paper. During the advocacy, I've never spoken to anyone who believes it is constitutional to lock someone who is mentally ill in a prison. Every American has the right to life, liberty, and the pursuit of happiness. When someone is convicted, they lose that right to liberty. The loss of liberty is punishment. We should not be punishing someone who is sick. I have been told that the prison is cold and has cold showers even in the winter. And a patient was told last year that if he refused to shower, he would be moved to the F ward, which is 24/7 security lockdown. I speak with patients on a daily basis that are in the SPU. They tell me of harassment and neglect by the guards and the medical staff. One patient was denied a breathing tube for his CPAP machine until I called legislators to ensure that he had his life-saving equipment. He later told me that a guard laughed at him and said, "Ha, if you get COVID, you will die." I've filed lawsuits for patients that were denied transfers for months and even years after they were approved to be transferred to New Hampshire Hospital. Now I see a bill that proposes to remove provisions of not hiring for-profit contractors. Many formerly corrections care organizations have rebranded and become for-profit institutional care organizations. One of those organizations' lobbyists have been attending all the hearings that I've also attended in the last 3 years. I've compiled articles about WellPath, that was formerly Correct Care Solutions, and was sued more than 1,300 times for patient deaths and civil rights violation. New Hampshire has unconstitutionally incarcerated mentally ill people for over 35 years now. In 2015, 51 patients were transferred from NHH to SPU. These patients have suffered for years because the legislature refused to appropriate money to build a forensic hospital. Who are these people who do not need Joint Commission accreditation? We as a state are finally appropriating the final half of the money to build the hospital. Please remove the language that would allow for-profit contractors in the management of the hospital. I have sent my written testimony to you, and there are many links to articles that I have just spoken about.
Are there questions of Mr. Rea, or have we lost you?
No, I'm still here.
Oh, okay. So Senator Avard has a question.
Thank you, and thank you for your testimony, and thank you, Mr. Chair. So could you, am I still here? Yeah, okay. I'm managing these. So anyway, thank you for your testimony, and could you explain again this whole concept of for-profit and accreditation again? I think I missed that.
Okay, so there are for-profit contractors that are not prison contractors.
Mhm.
And this one well path that I speak about was a prison contractor, but now they are just a for-profit contractor. And in fact, they actually do a forensic unit in Florida that they've been sued for. And I sent you guys, as I said, written testimony. So I have a dim view of these for-profit contractors after we have done this to these people for so many years. We need to do this right.
Follow up?
Follow up?
So are these for-profit organizations accredited?
I do not know whether they are accredited or not.
Okay. So how would you want this bill to read?
I would love for the bill to read that we cannot contract with for-profit contractors. Take the word prison out. Let's get somebody good to do this. I can't tell you all the stuff that I've been told in the last 5 years. As I said, I speak with people in the SPEW on an almost daily basis. I speak with others that we've helped to have transferred to the New Hampshire hospital. I've currently got 2 habeas corpuses in Superior Court for 2 different people, and 1 case in federal court, and we've got an attorney assigned for another federal case.
All right, follow up one more and I'll be done. Wanda, you did say get rid of the for-profits and find someone good. What would that mean? What do you mean by someone good?
I think maybe Dartmouth Hitchcock. I think an accredited not-for-profit medical agency that does this. I think that the state of New Hampshire could do a good job if they choose to.
Thank you.
Thank you.
Further questions of Mr. Rea? Yes, Senator Sherman.
Let me just get back to the bill. This is the problem with electronics. Mr. Rea, thank you so much for your testimony. I think we've met during prior hearings on the SPEW, and I really appreciate your advocacy for the patients that are housed there, because that's what they are, is patients. I'm looking at the original language and thinking about what you're talking about. And the original language reads, "This facility shall be operated and managed by the Department of Health and Human Services. The state shall not enter into a contract with a private or for-profit prison company for the construction or operation of this psychiatric facility unit." I remember that wording was in there to make sure that what you're describing didn't happen. And I see this new wording seems to open a door to the management. I'm not sure what the difference between operation and management is, but that the management could be contracted out really to anyone. On the other hand, there are for-profit hospital systems that have really pretty excellent psychiatric units, like HCA Portsmouth, HCA Parkland in Derry. I'm wondering if the key to this would be wording that would require that the new unit be an accredited unit, and that accreditation in hospitals, and I'd have to do some digging, but it would be in something like JCAHO, joint, whatever JCAHO stands for.
Commission.
Yeah, Joint Commission. And so if it said, if we went back to the original language, it's unfortunate that Senator French can't tell us why this. I'll try to talk to him offline. But if we went back to the original language or somehow did a hybrid that would capture the ability for the department to contract out but require accreditation of the unit. Would that meet?
That may be a really good thing of having the accreditation, which the SPU obviously does not.
Yeah, I'm just thinking about a compromise here that would allow some flexibility for the department, but also ensure a certain threshold of quality for the patients.
That is very definitely what I am advocating for, quality for these patients.
All right, thanks.
Any other questions? Seeing none. Thank you very much.
Thank you very much.
Senator Whitley, did you have a question? Oh, okay. Thank you very much. I know you've testified several times in front of the committee with Senator Avard and Senator Gray, myself, Senator Sherman. So good to see you again, and thank you for your advocacy. Okay, Griffin.
Next up, I have Ken Norton.
Good morning, Ken.
Good morning, Senators. Ken Norton from NAMI, New Hampshire, the National Alliance on Mental Illness. And I have a family member who has been repeatedly incarcerated as a result of mental illness and addiction. NAMI nationally has really promoted the use of promoted help and not handcuffs for people for all of the reasons that Wanda has just testified. And generally, we're in support of Senate Bill 156, but I have a few comments and questions that I would like to make, some of them already raised by Senator Sherman. And, you know, the first is just about language here, that it's my understanding that that the secure psychiatric unit currently at the Department of Corrections will not close, that this new facility will be in addition to. And so I think at some point we need to start using some other language to call what this new facility will be, presumably a forensic hospital, and to differentiate between the unit at the Department of Corrections and the new unit. And the other piece is the question that Senator Sherman raised relative to the language about currently in the bill, that this facility shall be built to house such persons that do not require continued Joint Commission accreditation. And my understanding is that some of these folks would need a hospital level of care, and that's why we're building this facility. I don't know, and I should know this because I've been on several of these commissions, whether the Joint Commission does accredit forensic hospitals. And I know that there is another accrediting body. I'm working from my home office. I think I have some of that information in my office from some of the previous commissions, but would certainly encourage that accreditation be a key here. And yes, and I'm aware that, generally NAMI nationally is opposed to for-profit prisons. However, I think that part of what Senator Sherman was getting at is that there have been some, I don't know if they're nonprofit or for-profit, but they are private entities that have specialized in forensic hospitals and have greatly reduced the use of restraints and solitary confinement. I think that there's one example that I think the state had visited is our neighbor to the south, and dramatic changes in the approach to that, which comes with the change from having the focus be on security to having the focus be on treatment. And, and that's really a key here. And then lastly, I would just suggest that at some point along the way here, that as we look to transfer the operation of this from the Department of Corrections to the Department of Health and Human Services, that we may want to request some type of plan from DHHS regarding what training is needed to operate this type of facility. By my estimation, it's been 35 years since DHHS operated what was then the forensic unit in the main building on the grounds of the state hospital. So that's my testimony. I thank you for your ongoing consideration for these important issues. I thank Wanda for her continued advocacy on behalf of these folks, and I'm happy to answer any questions people have.
Thank you very much, Ken. Senator Gray, can you take over for a couple of minutes?
As soon as I find the unmute button. All right. Do any of the committee members have questions for Mr. Norton? Seeing none, thank you.
Thank you.
Was it Kristen? Were you the one that was calling? Or? Oh,
I got it, Senator.
Robert. Okay.
Next person I have is Andrew Hosmer.
Senator.
Thank you very much. Good morning, senators, and thank you for the work you're doing. I want to say thank you to Ms. Torreya and the work that she's done. I've certainly been familiar with her advocacy throughout the years, and it's very powerful. It's passionate. It's patient-centered, and really appreciate it. And also with Ken's work from NAMI as well. But again, my name is Andrew Hosmer. I'm with Preddy Strategies, along with my colleague Peter Bragdon. We've represented WellPath, one time known as Correct Care, for a number of years now. I've worked closely with Senator French over the years on addressing some of the situations that exist in the SPU. And certainly I will say that our primary focus has been improved care in a therapeutic environment for people who are currently in the SPU or anybody suffering from mental illness. So that has certainly been our focus. WellPath is a provider of localized, high quality, compassionate care to vulnerable patients in challenging clinical environments. WellPath is not a private prison provider or builder or management company at all. Ken Norton referred to our neighbor to the south, Massachusetts, and Bridgewater State Hospital, which is a spot that WellPath had came into after many decades of operation by the Commonwealth of Massachusetts, and the outcomes were not particularly good. The environment was not therapeutic, and WellPath has certainly had a transformational impact on the quality of care and the environment and the outcomes in Bridgewater State Hospital. So this is really something that we've and working with Senator French, we took a look at the RSA, and what we thought that would be an improvement to the RSA would be to allow to, one, reinforce that patients in the SPU are the responsibility of Department of Health and Human Services. Right now they are, as Ken alluded to, certainly in the custody of DOC. And certainly in a more therapeutic environment, we think the outcomes would be better and the care would be improved. So what this bill allows for is that it allows the commissioner the discretion to make a determination on who would be the best public or private provider of services within a secured facility. Certainly that is no doubt would be through a competitive RFP process that's transparent and has integrity. But we think that this is one of the instrumental steps in improving how we treat these men and women who need care, not cuffs, as Ken alluded to. And so I'm happy to take any questions. I have been speaking right along with Senator French, and I know it was sort of a last minute thing today that he couldn't make it, but if there's some questions that I might be able to answer having been involved with this, I certainly appreciate the collaborative approach that Senator Sherman suggested, and maybe making some amendments to this to clear it up. I will say that I don't quite understand the accreditation portion of the RSA right now. Certainly I am more familiar and work with folks who are involved in accredited institutions as well. So I think that it would be an improvement right out of the gate. Thank you very much.
Are there
Senator Sherman.
questions of Senator Hosmer?
Just a citizen right now, Senator Bradley. Just a
Yeah,
citizen.
I know, but the title stays with you. So I know Senator Whitley.
Thank you, Mr. Chair, and thank you, Senator Hosmer. So I'm wondering if you could answer the question that Ken raised about whether other forensic hospitals have a different accreditation.
Yeah, I think if I'm not mistaken, the accreditation process is sort of at the discretion of the hospital as to whether they choose to apply for it. Certainly, we are a believer in the accreditation process. We think it brings a higher standard into an institution. And when you live up to those standards, we believe that the care, the quality of care is better, the protocols are better, and we believe it results in improved outcomes as well. So it's certainly something that we embrace.
Further questions, Senator Sherman?
I think Senator Whitley has.
Yeah, I saw her hand after yours, so go ahead. Yeah, no worries.
Follow up. It was just a follow up, or if do you know any of the accreditations that other forensic hospitals, like the actual bodies that do the accreditation?
I believe it is the Joint Commission. I can, and thank you for the question, Senator Whitley. I apologize for not thanking you initially. And I'm happy to do some follow-up and direct it along to you as well as fellow members of the committee as to the accreditation. And I know Bridgewater State is accredited by, I believe, the Joint Commission. So I think that's wise to look in that direction.
Okay, thank you.
Okay, now Senator Sherman, go ahead.
Thank you. I have a couple of questions. Hello, Senator. Good to see you.
Hello, Senator.
We've talked about this issue in the past in my former office before I was sent to the dungeon. One of the concerns, well, actually, one of the benefits of accreditation is you can actually bill for services, which we've talked about in the past, whether at least a portion of the SPEW or New Hampshire hospital stay would be reimbursable either by public or commercial providers. So that's just a comment. But I'm wondering, having listened to Wanda's testimony and then listening to your testimony, I hear kind of a disconnect. You say that WellPath is not a private prison company. Is it true that WellPath was or WellPath's parent still is a private prison company?
So thank you for the question, Senator. That is totally incorrect. Neither Correct Care, which was the original company before it changed names into WellPath, has never been a private prison builder, provider company. They do offer forensic services in various institutions, but there is a distinct difference between a private prison builder and manager and for-profit prison operation than WellPath.
Follow
Follow-up?
up. On a slightly different question, one of the things in the wordsmithing of this amendment that I'm trying to fully understand is the difference between the words operation and management. I just am trying to figure out what is that difference, and what would you say is the difference between operation and management as used in the as used in this bill? Because to me they feel kind of interchangeable, but I'm wondering what that means to you.
Again, thank you for the question, and I don't think there's a difference. I think it's a choice of words. I don't see the distinction between the two words as it pertains to this language in this bill. So certainly amenable to the language that you find or the committee finds preferable.
All right. I think that's it. Thanks.
Okay, further questions? Okay, seeing none.
I see Senator Whitley with her hand up.
I'm sorry.
Thank you, Chairman, and thank you for taking another question. So I'm not sure this question is for you or the department, but I'm curious about, whether there's been an analysis about the what capacity we actually need in New Hampshire. So this bill contemplates a 25-bed secure psychiatric facility. And then I think HB2 contemplates a much larger facility. So I don't know if if WellPath has, conducted analysis, or you've discussed the capacity question with DHHS that you could share with us.
Thank you for the question, Senator Whitley. That is sort of outside of our purview. We weren't involved in making a determination or analysis of what the state needs for capacity. So I wish I could shed some light on that, but I can't.
Further questions? Okay,
Thank you very much.
thank you very much. Yep. Okay, so Griffin,
The last person I have signed up wishing to speak is Paula Mattis from the Department of Corrections.
okay,
Good
go
morning.
ahead, Miss Mattis.
I'm so sorry. Good morning. Can you hear me?
Yep.
Excellent. Okay. Thank you for allowing me to speak. First, I'd like to refer you with great respect to the written testimony I sent to all of you last night, and Kirsten as well. I want to be clear that we share with Ms. Durea and other advocates the same value of removing the civilly committed from the secure psychiatric unit operated by the New Hampshire Department of Corrections. I would also like to mention that there is a document I attached to my testimony called SPU, Secure Psychiatric Unit, The Time Is Now, which I hope will be helpful to you all in terms of understanding all the various groups that have been involved in making this decision. I am currently the Director of Medical and Forensic Services for the New Hampshire Department of Corrections. Prior to that, I have a work history that includes 14 years at New Hampshire Hospital. My last role there was acting CEO. Prior to that, I worked in private psychiatric hospitals. I also have several years in community mental health. I've been recognized by various peer organizations, including Social Worker of the Year from New Hampshire Chapter, National Association of Social Workers. I have been given the Rainbow Award by Community Mental Health Center Riverbend. I've also been recognized by my fellow hospital administrators. I'm a fellow in the American College of Healthcare Executives and have been the recipient of the Regents Award. Why do I say that? I want you to know that I am not someone that is seen by my peers or others as allowing some of the egregious statements that Ms. Durea made about care at the psychiatric unit here by the New Hampshire Department of Corrections. This is not a hearing on whether or not we are moving forward with taking the civilly committed out of the prison system and constructing a new facility. From everything I've read and heard, that's been decided. This is not a referendum on whether or not there's adequate care at the secure psychiatric unit, because I can tell you that all of these things, toenails growing into people's feet, not getting breathing tubes, none of that has been brought to my attention, and I would not tolerate it. We work with very, very, very ill people there. By definition, with their mental illness diagnosis, their perceptions are off. I respond to grievances weekly from a man who believes Mexicans are invading his room. I got a grievance from someone who told me COVID doesn't exist, and shame on me for instituting certain practices to ensure safety for people with regard to the COVID pandemic. Perceptions are frequently altered when you are in the acute phase of a mental illness. This is not anything Paula Mattis made up. This is real. And we work with people who misunderstand, who are afraid to allow us to wash their hair, cut their nails when they are acutely ill. Ken Norton, thank you for recognizing that we need to continue to have an inpatient psychiatric option for the incarcerated people. I would ask the advocates to also think about those folks. Mental health advocates across the country are well aware that prisons and jails have become the state hospitals of our country. We have very sick people that we challenge daily to take care of, to help, to move forward in an environment that isn't hospital-like. No one is trying to say, I've testified many times, the SPU is not a pretty building. be delighted to construct a new facility for those who are in our care. It costs money, and we have to prioritize as a state where money goes. I understand that. I would finally like to say that when I hear people maligning the staff, the kind of care, Mr. Posner, as an aside, please forward to me how you feel the care can be improved at the SPU. I promise you I will look into it and review it with all seriousness. But there are people like myself who, at the end of my career, I decided I wanted to work with those who are most in need, even more than those with major mental illness, and that is the justice-involved population. That's why I'm here. I can work other places. So can the staff I've recruited from New Hampshire Hospital and other places. We have certified, qualified people, Dartmouth-trained psychiatrists. We are fortunate to be fully staffed at this secure psychiatric unit at this point. We are not that fortunate in other parts of our system with regard to behavioral health care. When I hear people, and especially advocates, colleagues, it's painful to hear them maligning people they know to be outstanding, upright practitioners. I also say, if you really care about the patients that need help for mental illness, you don't want to malign the prison system. We need good people. We need the best people to help the sickest people in our care. Thank you for allowing me to share those thoughts. I had no intention of doing that. In fact, I told my husband this morning about the testimony that it was simply going to be, thank you so much for considering our written testimony, and we're available if there's any question or help we can provide. And here I am 4 minutes later, still talking. I apologize to the committee, but I want to be really clear. Some of the statements made today on the record need to be refuted on the record, and that was my intent. Thank you for your indulgence, and I do have time for questions. In fact, I have all morning if that were needed. Thank you again.
Thank you very much, Ms. Mattis. Yes, Senator Whitley.
Mr. Chair, and thank you for your testimony, Ms. Mattis. So I'm wondering if you could answer that question that I asked of Senator Hosmer about your thoughts on the capacity. We have a bill here that says 25. We have HB2 that says 60. So I'm wondering if you had thoughts from your perspective and your experience with this population about what the necessary capacity is in New Hampshire.
Thank you, Senator Whitley. Having been involved in some, but not all of the planning committees, I can't formally speak to how that number was arrived. I suspect it may have been partly due to finances in terms of these kinds of buildings. I don't have to tell you, are very, very expensive to construct. The bigger they are, i.e. the more beds there are, the more space you need for everything. And that may be indeed what happened. I was looking at our census this morning just to see, and the civilly committed, it fluctuates. There's not like patterns that I could offer to you to help say that. But today, today, with the folks at the SPU, I'm not talking about who might be out there that I'm not aware of, 25 beds would be fine, would cover that. How the fluctuations, that's very difficult. As you probably know, from any kind of inpatient setting, things fluctuate. You try to build for a cushion, but that is, again, that's expensive. I'm sorry I couldn't be more clear. Again, I wasn't in all the meetings, so it makes it hard to know all the information.
Follow up?
Further question?
Just a follow up? Yeah. So thank you, Mr. Chair. So what is the census today, Ms. Mattis?
Are you talking about the total census, Senator, or just the civilly committed?
Total, well, both, that would be helpful.
Okay, I can easily give you the census today. Let me just do a real quick check here. 35. And then the civilly committed, it would take me a minute. Would you be okay if I emailed that to you later, or?
That'd be great, thank you.
All right, I'll make a note to do that. Okay, I've written that down. I will get that to you, Senator.
All right, Senator Sherman.
Yeah, just following up on Senator Whitley's question, and thank you, Paula, for coming. I had a wonderful tour. I think Senator Gray was with me a couple of years ago of this view, and was actually pretty impressed by the work you do in that setting. So thank you for all the hard work you put into this.
Thank you.
But I still agree. I agree with you, and I agree with everyone else that having forensic patients within the prison system is not optimal, to say the least.
Agreed.
So, of that 35 and additional, am I correct in understanding that if we built a forensic hospital, many of those patients would not transfer over because they are not part of the forensic population, even though they're housed at the SPU? Or would they all transfer over?
Of the 35, Senator Sherman, not all.
Yes.
I'm sorry, not all of them would go. I mean, the whole basis of this is that we have people who are convicted of crimes
Right.
in the same treatment facility as those who are civilly committed. So we need to maintain an inpatient unit. Ken Norton brought up the point of the names. I was surprised when the first legislation came out because we testified in support. We had suggested not to call the new facility the Secure Psychiatric Unit because of the administrative and burden that will be involved in doing rules and laws, etc. But we're happy to change our name. We see it as an opportunity to rebrand, quite frankly. But no, as of today, Senator, most people in the Secure Psychiatric Unit would stay if we could move them to a forensic hospital today. There would be some moving, but most would stay.
So, follow-up?
Follow-up?
So is the number that you're going to get for Senator Whitley, is that the number that are currently civilly committed that would actually be the ones eligible for this new hospital?
That's my understanding of what she was requesting, and I intended to send it to all of you. Senator Whitley, please, if I misunderstood, let me know.
Follow-up?
That's accurate. Thank you.
Follow-up is there a waiting list for getting people into the Secure Psychiatric Unit?
As of today, I would have to confirm this, Senator, but I believe there are two. One is the New Hampshire Hospital person, and one is a county House of Corrections person. The reason is that we may have beds available in our lesser restrictive units, but many people need the infirmary bed.
Right.
We have 6 infirmary beds.
Right. And I understand that from that tour. Follow-up?
Yep.
So of those 2 on the wait list, only 1 would be eligible for a new hospital because
Correct.
only 1 is civilly committed, the other 1 is incarcerated.
I apologize for talking over you. That is correct.
And I guess one last question. You've had the experience at New Hampshire Hospital similar to your commissioner, if I remember correctly. And this notion of accreditation, which I think is one of the really critical aspects of what makes a hospital, is that level of quality assurance. Is that something that you have experience with, that you would recommend be a part of the statute, that whatever facility is built would need to meet Joint Commission or equivalent accreditation standards?
Senator Sherman, I hesitate to, first I want to say it's been 9 years since I worked at the hospital. My life has gone a different direction. I actually ran a small nonprofit before I ended up here. And so I would hardly put myself out there as an expert currently on New Hampshire Hospital. What I would say to you is, as a practitioner, I firmly believe, as you've stated better than I could, about the value of any kind of accreditation. I would also add that, and you know this, but for the committee's benefit, these accreditation surveys, they cost money. That needs to be factored into the budget. That may be part of what's happening there, Senator Sherman. I can't speak to why that was added in this, but we are, as you know, looking forward, hopefully, to being accredited by the National Commission on Correctional Healthcare. It's a mouthful, and are working towards that. We've always used their standards anyway for healthcare, but we would love to have accreditation, but it costs money. But we are moving forward with that here. So that's a roundabout answer to your question, Senator.
What was that commission again? National Commission on what kind of healthcare? Correctional?
Correctional Healthcare, NCCHC. There's another group for corrections. I'm talking not hospital, the ACA, American Correctional Association. They also offer accreditation, but by legislation, we are seeking the NCCHC accreditation for the secure psychiatric unit, or whatever we'll be calling it.
Thank you so much.
Further questions of Ms. Mattis? Okay, seeing none. I was told by Griffin that Commissioner Hanks had raised her hand. So if we can bring her in.
Good morning, Senator Bradley and other members of this committee. Appreciate your attention. I was hesitant to sign in today because I have to head off to Governor and Council, but wanted to help with some history here with regard to my participation and this agency's participation. We certainly have been an advocate, as has been discussed, to transfer back and undo what happened in the 80s, if you will, to return those civilly committed patients back under the strict supervision and treatment of New Hampshire Hospital and DHHS as a whole. To Senator Whitley's question, and I believe Senator Sherman as well, you asked where the numbers came from for bed space. I will look to find the document and work with Commissioner Shibinette and Commissioner Arlinghouse, because we did come together in a time before COVID-19 and examined the bed census at both facilities, the numbers of civilly committed, and worked to present a number that would be appropriate, including forecasting. So that document does exist. I'm just trying to put my hands on it, and I will share that with the members of this committee. But a lot of work and time went into that, and we brought in members of our state public works to also talk about and forecast construction costs. So it's exciting to see this bill forward today, and we're hoping to see some progress here in New Hampshire. I just wanted to offer that and assist.
Okay, thank you, Commissioner. Are there questions? Senator Whitley.
Thank you, Mr. Chair, and thank you, Commissioner Hanks, for coming on. So the number 25 that's in this bill, is that consistent with the work that you're discussing, that interagency work?
I hesitate to affirm that for you. It feels a little less than what we advocated for, trying to draw back from a couple of years ago. I think our number was higher, but as I said, I'll work with Commissioner Shibinette, Commissioner Arlinghouse to make sure we get the final proposal to this committee so you can evaluate that. And again, times have changed, so maybe the number is relative to some information over the last couple of years.
Okay, thank you.
You're welcome.
So I would just add, I think as more historical than part of a question, during the last budget debate 2 years ago, I think that we had introduced an appropriation, as I recall, for $26 million for creation of a new facility. Would have been, in my remembrance, Commissioner, larger than 25 beds. This, which was reflected in House Bill, well, would have been 4 in 2019, was a compromise. So that's certainly my recollection of what happened.
Senator Bradley, I think you're right, which is why I hesitate to affirm that number 25. And I believe we were looking to address some other issues with a larger capacity. But I do recall we did have a formal document that did that analysis that will assist this committee as you examine this bill.
Yep. Okay.
Thank you for that.
Further questions of the commissioner? Okey doke.
Thank you all. Headed off to Governor and Council. Take care, everyone.
There you go. Is there anyone from the Department of Health and Human Services that could answer Senator Whitley's questions?
Senator, I don't see anybody from the department raising their hands, but John Williams is present. I could bring him in if you'd like.
All right, why don't we bring in John, and if he can't answer your question, Senator, he'll be able to get back to you, okay? Good morning, John.
John, you have to unmute from your end. Can't quite get through to him, Senator. He just needs
John, like all the rest of us, is multitasking, I'm sure, so. I will text him directly right now.
Senator, if you'd like, I can try to reach out to John Williams offline. I just know, I believe Senator Carson is maybe waiting to introduce her bill next.
All right, Senator Woodley, let me ask you, John is probably going to monitor the executive session. Are you willing to ask him any questions on 156 and exec session?
Yeah, that's fine. I just feel like because this bill, involves DHHS, they're going to be taking over the management. The capacity issue is important, and then just sort of how they feel about the other aspects of the bill, I think, are important.
Hi, Senator Bradley. Good morning, and members of the Senate Health and Human Services Committee. I'm sorry, I had stepped away from my computer for a second. I will have to be joining the House Finance Division 3. I understand you're on the bill involving the secured psychiatric unit and the limitations of not hiring a for-profit contractor. I expected on this call also that we had Joe Caristi, who is our financial officer for New Hampshire Hospital, as well as Heather Moquin, who is the chief executive officer for the hospital. So I apologize that I missed the question, but I believe if whoever is the Zoom host for this meeting, if they could identify them, they are available to answer questions as needed.
Okay, so Senator Whitley has questions of the department. So I don't know, John, if the other individuals, Ms. Moquin, are on the Zoom or not and can answer questions.
John, if you could have them raise their hands, I'm not seeing them listed in the attendees list.
All right, so what I can do is if I can go offline just in a moment, and I will call Mr. Caristi and see if we can have one of them available as soon as possible. I was expecting them to be on this. Also, just by way of background, and you're probably already aware, but in HB 2, as introduced, there is a provision around the secured psychiatric hospital. And I just wanted to bring the committee's attention to that it did make its way into the governor's proposed trailer bill to the budget with some language as well. It's not regarding prohibition, but it's around the actual standing up of the secured psychiatric facility. All right, so Senator Bradley, with your permission, if I could just go offline at this point, or thank you very much, committee members. I'll have somebody from New Hampshire Hospital immediately get in touch with you folks. My apologies, I have a conflict.
Yeah, no worries. I understand. So Griffin, is there anybody else who wishes to testify while we're waiting on?
I do not see anybody wishing to speak on this bill. Obviously, if they wanted, they can raise their hand or press *9 if they're on the phone, but I do not see any hands raised at this time.
All right, Senator Sherman.
Yeah, Mr. Chair, should we recess this hearing and move on to the next one and come back? The only reason I say that is that I would like to have whatever the department says as part of the record rather than in exec session, if that's
okay. You know what? Let's take a 2-minute break and see if we can As long as, is that going to be all right with Senator Carson? Because I know she's trying to run ED&A.
I think she'd like to get back to ED&A, Senator. I think they got quite a bit of stuff to do over there
All right.
today.
Then we'll go along with that. We're going to recess the hearing on Senate Bill 156 to the conclusion of the hearing on Senate Bill 159. So later this morning, for the purposes of Senator Whitley, Senator Sherman, and anyone else to ask questions of the Department of Health and Human Services. So if John, if you're still listening, if those folks can monitor or at least be available via phone or text so that we can let them know, that would be helpful. Everybody good with that? All right, I'm going to recess the hearing on Senate Bill 156 and open the hearing on Senator Carson's bill, Senate Bill 159. Good morning, Senator Carson. Sorry to make you wait. Senator Carson, you are muted. I just texted her. I'm sure she'll be.
There we go. There we go. I think she's
Good
in.
morning, Senator Carson.
Oh, thank you. Thank you so much, Mr. Chairman, and many thanks to your assistant Griffin Roberts this morning for keeping me up to date. Good morning, Mr. Chairman, and good morning, members of Health and Human Services. I have my name is Senator Sharon Carson, and I represent Senate District 14, comprising the towns of Londonderry, Hudson, and Auburn. And I have for your consideration today Senate Bill 159 FN, which seeks to establish the Department of Children's Services and Juvenile Justice and transfers the powers and the duties of the Department of Health and Human Services Division for Youth, Children, Youth, and Family Services to the new department. This bill was filed originally a few years ago when we started coming up against all the problems that we were seeing within DCYF and Children's Services. And I thought this was a good time now to reintroduce this legislation. Unfortunately, only parts of it were adopted, including the Office of the Child Advocate, which has been doing a great job and has really has done a lot of good work for the children of the state of New Hampshire. But I think it's time that we have a really serious discussion about creating a new agency with its own commissioner and its own responsibilities. I think all of you know the Department of Health and Human Services is huge. It's probably the biggest agency we have in the state of New Hampshire, and they do they do a great job for us. But it seems that Children's Services, if they don't have people that are strong advocates, I think sometimes the work that they do is not recognized, and it kind of gets put on the back burner. And again, that's my opinion. I would guess that most of you know that Joe Ribson, and I know most of you are probably familiar with him, won a national award for the work that he's done for DCYF over the past year or so. But we're seeing that there are multiple problems concerning children, and they're very complex. They're not easy to solve. There's no one easy answer. And I feel that having their own department that's going to deal just with children's issues is really critical as we move forward. Their issues are not going to fall on the back burner. They're just really, it's so important. We've seen how children have been affected by the opioid crisis, and now we're seeing children that are being affected because of the issues concerning COVID-19. And I will say there probably needs to be an amendment to this because they did not include children's behavioral services within this new department, and it's critical that those services are transferred over to this new agency. I think most of you know that I've done a lot of work on this particular issue, on children's issues, as has Senator Bradley and a number of other folks in the legislature. And I just think it's time that we recognize that they need to have their own agency, their own department, with their own commissioner who's going to be held accountable for what happens and what doesn't happen. As you know, over the years, we've been sued, and in fact, we're facing another lawsuit. I just think it's critical, and it's time that we move forward with this. And with that, Mr. Chairman, I'm going to end my testimony, and hopefully, I'm sure that there are folks behind me who would like to testify. I've had discussions with a number of child advocacy agencies, and they're all in support of this. So I think it is time that we move forward on this. There are financial implications, but those are very few because the actual structure is already in place. So again, Mr. Chairman, I would like to thank you and the committee for your time this morning, and I'm just going to ask you to withhold your questions for the folks that are going to be testifying after me. Thank you very much.
Okay, thank you very much, Senator Carson.
Thank you, Mr. Chairman.
Griffin.
So the next person I have is John DeJoy, but I do not see him signed up on the attendees list. John, if you're present, please. Oh, he's calling in by phone.
Okay, Senator Gray, can you take over again for a minute?
Yes, sir. Mr. DeJoy.
Thank you, Griffin. I appreciate it. And Mr. Chairman, I apologize for phoning in. I'm without internet service this week, so this is the only option I had to speak with the committee.
It's pretty much the same whether you come in on the internet or on the phone to us. So go ahead.
Thank you, Senator. Good morning, Mr. Chairman, members of the committee. For the record, my name is John DeJoy. I represent Waypoint. Waypoint, which is formerly known as Child and Family Services, has been serving children and families in New Hampshire since 1850. We provide services across the lifespan, from early supports and services, foster and adoption services, teen homeless services, voluntary services for family resource centers, and choices for independence for seniors. I have submitted testimony to the committee, so I will try to hit some high points and not cover the entirety of the testimony. I am pleased today to rise in support of Senate Bill 159. Waypoint supports the creation of this child-focused agency. And as Senator Carson just pointed out, we also agree that children's behavioral health services ought to be a part of this conversation. It's becoming a more and more important piece of children's services and rightly belongs in this the proposed combined agency. Let me begin by just saying that this bill is not intended to be an indictment or a message on any administration or commissioner, past, present, or future. This bill simply seeks to act on the fact that the Department of Health and Human Services is a mammoth agency. More than 3,500 employees, more than $3 billion budget, over 10 divisions, and out of necessity, the department is unable to plan, future plan for all of these services. And oftentimes what we see is that the crisis is what rises to the top. We saw that back in 2015, as the Senator just mentioned, with the Booten Commission. And many of the changes that have happened under DCWAF in the last 5 years emanated from this committee. Things like the Office of Child Advocate, the system of care, the increase in child protection workers. We believe that for children's services to truly get the focus they need to be in their own agency and not competing with other important divisions and other important messages. They need to be in their own department to preserve the changes this committee has made and to make sure the kids' issues are front and center across the state of New Hampshire. With that, I will conclude my testimony.
Thank you very much, John. Are there questions of Mr. DeJoy? Senator Sherman.
Yes, thank you, Mr. Chair, and thank you, John, for testifying. You know, this is really interesting bill and interesting concept. How would you, you know, one of the things about SB 14, the work Senator Whitley has done, Senator Feltus and others, Senator Bradley, with SB 14 and system of care is bringing children's mental health services over into this new department would be sort of a natural thing to do. But I also, as a physician, I get concerned when we start separating out children's mental health or anybody's mental health from their physical health and their dental health and health in general. It's, you know, we've been moving towards treating the whole patient, treating the whole person, looking at the wraparound services that really Medicaid, I think, is doing almost a better job than any commercial carrier on being able to do those wraparound services. How would we continue to provide this comprehensive care to children if we pulled out mental health and put it in this department? Would you foresee some type of MOU with the Medicaid division or with the Department of Health and Human Services to be sure that we don't once again silo mental health rather than have it incorporated into comprehensive health care that's available to children?
Senator, thank you very much for the question. And clearly MOUs will be necessary in certain areas, but I in fact see this as an enhancement of children's services, not a diminishment. What's happened as the system of care has been built out is that the Children's Behavioral Health Division has grown. Those services are not part of DCYF, which is our child welfare agency. And so there is currently a silo between those two divisions that I think bringing them all together will actually enhance children's health. I do think Medicaid is separate, but I think you'll note in the budget that all the Medicaid money has been pulled out of DCYF this year and moved into the Medicaid division. So I think there's issues today that present siloing in care. I think that the system of care didn't intend this, but I think the way it's being built out within the department, some siloing may be happening with the system of care in regards to DCYF. And bringing them all together, what it does is it permits long-range planning for children's services. And you don't have the leader of the new division, whatever we call it. You don't have that leader having to compete with the developmental disability community and the public health community and the Medicaid and all the other necessarily competing interests. You have children's interests front and center. And I think that is the most exciting piece of this. And I think that bringing behavioral health in fact, brings all the kids' services together in a single agency.
Further questions, Senator Sherman? Senator Whitley.
Thank you, Mr. Chair, and thank you for taking my question, Mr. DeJoy. I'm wondering if there are I have a couple questions, but I'm wondering if there are other states that have done something like this, pulled children's services out of DHHS.
Thank you for the question, Senator. I don't have the research in front of me, but my understanding is that, in fact, 15 different states, as recently as 2017, have pulled children's services out of a broader Health and Human Services network. I'm not sure whether the child advocate will be prepared to speak to that, but I believe her office has done some research on that.
Follow.
Yeah, thank you. Thank you, Mr. Chair. And so the other question is sort of thinking through the funding silos. So as you rightly identified, we do sort of set up state government in New Hampshire through funding silos. And it is true that Medicaid does pay for a lot of these programs, including a lot of the work that's happening for children's behavioral health. So I'm wondering if you had any thoughts about how sort of separating this from Medicaid has implications on paying for these services.
So that's a great question, and I'm still paying attention in the House phase of the budget to understand that better. You know, there's an argument that says there's really no impact because it's simply moving the same dollars around. But it's not clear to me yet what the impacts might be, and I'm still trying to get a better handle on that.
Further questions? Seeing none.
Excuse me, Senator Bradley, I just want to clarify, I did not receive written testimony from Mr. DeJoy. Not sure if he sent it to just the senators, but if you could please send it to me, Mr. DeJoy, I just want to ensure that we have that.
Mr. Chair, can I ask who's speaking so I can send it to the right person?
It's
I'm sorry.
Kirsten, our aide, committee aide.
Okay. I'm happy to send it to Kristen, and if any of the senators didn't receive it, I sent it this morning. If any of the senators didn't receive it, I'm happy to resend it.
Okay.
Senator Bradley, I'll do that for Mr. DeJoy so he won't have to look up the address.
Okay. Terrific.
Thank you, Senator.
Thank you, sorry.
Okay. Next.
Next person I have signed up wishing to speak is Maura O'Neill.
Good afternoon. We're getting ahead of ourselves. Good morning, Maura. How are you?
I have two labeled New Hampshire Child Advocates, so I'm not sure which one.
Can you hear me?
I'll go with that one. Okay. Yep.
Good morning. Good morning, Senator Bradley and members of the committee. For the record, I'm Moira O'Neill, the State Child Advocate. I have submitted written testimony. I hope you've received that. We appreciate the opportunity to speak in support of Senate Bill 159 today. As you have my written testimony, I also will just try to hit some of the high points and be happy to take questions as well. As I said, we do support this bill. We have several recommendations for amendments on it. Our vision for a new agency for children starts with the name, a Department of Children's Services. By dropping the juvenile justice from the name, we achieve a couple of things. One is that you create an all-inclusive children's services agency for the whole spectrum of childhood, from early supports, developmental disability supports, behavioral supports, as you've been discussing, the child protection, the juvenile justice, and the transitional services to adulthood. Also, by dropping juvenile justice from the name, we recognize the essence of juvenile justice, which is that it's services for children so that they grow to be healthy, rather than separating that out and having that stigma related to that. We support this separate agency as a means of ensuring that children are a priority, as Senator Carson mentioned, and also as John DeJoy just did. There needs to be a focus of the services, and when resources are allocated for them, that they receive them. And we've all seen the delays in implementing key parts of 2019 Senate Bill 14, and the lack of clarity for the expenditure of related funds associated with that bill. We've been told that funds have been braided with adult services, and while we do support the idea of sharing the cost of infrastructure and overhead, if there isn't transparency about targeted expenditures, it's difficult to trust that children are receiving what's been allocated for them specifically. A children's agency alone will protect children and their interests. And it's really is a deep irony of child welfare that targeted resources for children may be used for adults instead of them. It's something that we really need to be paying attention to. The separate children's agency is an opportunity to conceptually align children's services. So for example, the governor's executive order establishing the Council on Thriving Children calls for an Office of Early Childhood Care and Education. So an office like that would be really well placed in an agency for children's services. That would serve to drive a continuum of prevention and care. Another recent suggestion is an Office of ACEs Prevention. And that would be grounded in geographical analytics that can identify areas of high risk for adverse childhood experiences and mobilize targeted prevention resources to those areas. So this approach would situate a new agency to be data-driven, to be results-based, and to be accountable. And that thinking also aligns with the juvenile probation transformation that's currently underway. We're capitalizing on the expansion of the community-based infrastructure that things like Senate Bill 14 supported to divert children from punitive systems. So we're more developmentally appropriate supports and paths to academic and personal success. So that's the vision that we would want for a Department of Children's Services. It's actually also the philosophy that was behind the expansion of the Office of the Child Advocate's jurisdiction last year, and including all children's services. We have to be taking this comprehensive approach that Senator Sherman, you mentioned, really looking at the whole child. And so having all of those services aligned and prioritized will achieve that. Equally as important in a new agency would be transferring over operational infrastructure, which the bill doesn't currently include. And that's things like procurements and human resources in order for them to function. So we have been researching the experience of other states and creating new separate child welfare agencies. Texas separated out their agency and they cited thousands of delayed investigations and other things happening. And they used Arizona as a model for change. Arizona went from being one of the worst child welfare systems in the country to being essentially a model agency at this point. And the creation of the Arizona Department of Children's Services was and remains very well supported as a separate agency. But in some of our conversations with folks in Arizona, we heard that the split was often referred to as a great divorce proceeding. And that was all around the resistance to bringing over the operational supports to make sure that the agency could function. And so our new child agency really needs to have all of the infrastructure that it needs to operate. So the breadth and internal support of the agency are the primary areas that we see in need of amendments. We have a list of small amendments that I could mention. They're in my written testimony, or I can stop here and just take questions. I know you're running behind.
So Senator Whitley.
Thank you, Mr. Chair, and thank you, Ms. O'Neill, for all your work on behalf of New Hampshire children. It's greatly appreciated. So just going back to that funding issue, I think that's one that's worthy of additional exploration. So the other thing I'm thinking about, just looking at the list of things that would be brought over to this new agency, is what are your thoughts on, whether we should separate or whether primary prevention efforts, family supports efforts, family resource centers, parental assistance, home visiting, all those family supports that we know if you support the family will get better outcomes for children. What are your thoughts about, separating those or bringing those together into this one agency?
Thank you for that question, and thank you for the kind words as well. I mean, our vision would really be to include all of that. It's all focused on, how do you raise healthy children here in New Hampshire? And you know that we don't have a lot of children in this state, so it's really important that we take as good care of all of them as we can. And oftentimes that does mean supporting their families. And I think that we're starting to make good connections in the networks around family with the interests of children. And so we would recommend bringing all of that over. And I think that it will become clear that when all of those sort of child-centric programs are together in one place, you'll be able to see that the priority is raising healthy children.
Further questions? Senator Sherman.
Thank you, Mr. Chair, and thank you, Moira, for coming. And I second the kudos that Senator Whitley has given you and all of the work you've done. I am still struggling with, or not struggling, but concerned about how we move the healthcare component for children over to this new department. It is so intricately interwoven with federal Medicaid funding. And also, as you know, the behavioral health side is so intricately interwoven with the physical health side. And then you start getting into developmental disabilities in children. I'm not completely clear whether that would move over to this department, but it would seem natural that it would. And then when we start thinking about families and FRCs, you know, I served on the Primary Prevention Council for the last 2 years. They are a critical component, not just for children, but also for the adult parents of children. And so I'm just, I'm wondering about how this department moves, you know, cuts the umbilical cord from the Department of Health and Human Services, but I worry about again, creating with the department, maybe an artificial separation from a lot of the funding and the and that comprehensive approach. So I'm just wondering, how would we continue that close connection with the funding that currently exists when all of this lives under one roof?
Thank you, Senator Sherman, for the question and also for the kind words. It's your worries. We have the same worries that you do. Only we have those worries now as the system is structured, because there is siloing, and when you create different divisions and things, you do start to bring those away. By way of history, the behavioral health for children has historically been in DCYF. It's been part of the DCYF agency. Just before the Office of the Child Advocate came into existence, it was sort of separated out. And the reason for that was because DCYF itself is identified as the Child Protection Agency, the agency of failure in the past many years, and the agency of that the state doesn't trust, or people don't trust. And that's not necessarily appropriate, but that's just what it is. And so they were trying to make sure that when children were coming into child protection or juvenile justice because they needed behavioral health services, that they didn't have to live with that conflicting sort of stigma that's associated with that. So they separated out. When kids go to these residential treatment facilities, they're not there under DCYF's care, they're under now child behavioral health. So there's this idea that it's treatment, it's not placement, and we're meeting kids' needs a little bit better. But then you end up again sort of siloing, and we're finding that folks in DCYF, the field staff, don't know a lot about the behavioral health programs, and there's still somewhat of a difference and children's behavioral health is still in adult behavioral health, and it does look like the prioritizing of the agency is still going to adults before it gets to children and the things that were allocated for children. So the idea of bringing together all of these services under the Department of Children's Services, including developmental services. And I think some of those things will actually bubble up as more needs, because right now, when you talk about developmental services for children, you're referred to the schools. You know, the Department of Health and Human Services doesn't really consider children as being served all that well with developmental disability services. So we want to sort of bring that together and have an eye for what do children need and build that up. So I think that the most complicated piece of all of this, of course, is the funding. You know, in many states, Medicaid is its own agency. You know, it's a funder, it's not a programmer. You know, so each agency runs their programs, and wherever the Medicaid dollars are coming from, they just pay the bill. And I think in a separate children's agency, there would be experts focused on children who could, you know, outline how are we going to spend our Medicaid dollars that are coming from the Fed specifically for children or children and families. So I do think that that could be teased out. It's definitely a big project, but I think it's a worthwhile project.
Further questions, Senator Sherman? Okay, seeing no more questions, Griffin?
The last two people I have signed up wishing to speak are from HHS, Rebecca Ross and Joe Ribson.
Okay, would Ms. Ross and Mr. Ribson like to speak together?
Yes, that would be ideal.
Good morning. How are you folks?
Good morning, Joe Ribson, Director of DCYF. Great to virtually see you all again. And with me is Rebecca Ross. I just want to make sure Rebecca can be heard too. Are you there, Rebecca?
Yes, good morning, everyone.
Great. So thank you all for considering this piece of legislation. I want to thank Senator Carson for bringing this forward. It is I think it's a really important conversation for folks to be having, to think about this. As many know, and as Senator Gray is probably a little tired of hearing about, did used to work in New Jersey, where we did have a standalone Department of Children and Families, served as Deputy Commissioner there for a number of years before coming here to serve as Division Director within Health and Human Services for DCYF. So I've worked in both types of systems. And what I could say, and why I think it's an important conversation to have, is that there are benefits and detriments to both structures. And I think the questions that are being asked today are really tapping into both those benefits and those detriments. And I think it's an important conversation for folks here to think about and make a decision about. The benefits, as I see them, coming from a state where we had an integrated system, where we had a standalone Department of Children and Families, and where that department was created out of some really high profile, awful situations. And is that the real benefit is that it elevates, as you're hearing today, the issue of children's services in perpetuity moving forward, right? So at this moment, DCYF has enjoyed, and I do say enjoyed because we've received a lot of benefit from this, a lot of attention from this legislature, from the press, from the governor's office. And that's been great, and it's left DCYF in a position where we've been able to make a lot of progress on a lot of issues, and I think have been able to help other divisions prioritize and invest in related issues such as children's behavioral health that you're hearing about here. What happened in this state, I think in part, and what happens in a lot of states, I think in part, is that when those issues are not on the front page every day, people tend to forget about them. And it can lead to a situation where those systems are under-resourced, or receive less attention than they need, and ultimately end up where DCYF was, 3 to 5 years ago. So I think the benefit is the elevation and the attention that a system can receive when it's made its own department. That attention, both in the budgeting process, but also in being part of the governor's cabinet and being part of those conversations on a regular basis. I think those are benefits. The detriments that we faced in New Jersey in that type of system, and that I've seen the other side of working here in New Hampshire, is that it is, for as much as folks would talk about silos and divisions, it is easier to work across divisions within one department than it is to work across discrete departments. We are heavily reliant on Medicaid, as was stated here. We are heavily reliant on behavioral health. I will just say, the reason we shifted responsibility for children's behavioral health out of DCYF is that, frankly, it never belonged here in the first place. DCYF was built to be child protection and juvenile justice. Children's behavioral health shouldn't be hidden behind those walls of child protection and juvenile justice. It needs to be available to kids based on need, not based on external criteria that are going on in their lives, whether it's through delinquency or through abuse or neglect. So we made that decision to move children's behavioral health into the behavioral health system for that reason. Other places, though, that we work very closely with others, with our Department of Economic and Housing Stability. We have partnerships now where we've been able to apply for federal grants to get housing vouchers for families who are at risk of eviction, for youth who are aging out of child protective care. We have, they're also managing our family resource centers at this point, and the facilitating organization with the Children's Trust, largely on our behalf with us at the table, but them not being the deep end system, the scary system that removes children, helps families, I think, feel more secure about that work. Similarly, public health has been a huge asset to us. They're actually managing one of our federal grants that was given to DCYF called Community Collaborations, which is the program which is doing the geospacing work that Director O'Neill spoke about, being able to identify specific communities and hotspots where additional prevention activities would be helpful. So all of this is to say that I think it's a complex question. It's a worthy question. It's a question that people really should take some time to think about and figure out what path means New Hampshire is best suited moving forward. The other thing that I would raise, and Director O'Neill raised this as well, is that DCYF is currently structured can't just be kind of scooped out like an ice cream scoop and stand up alone. We are deeply integrated into the rest of the department in terms of our procurement functions, our HR functions, our IT functions. Really anything and everything that's a backbone operation is part of the department and integrated. So it's not a simple task. It's a task that's going to take an awful lot of planning, an awful lot of work, and some additional resources. Being part of New Jersey's team, I joined them shortly after they were scooped out, and it was a years-long process of trying to kind of fight to get the right backbone operations to make it a successful department. And having lived through that once, I'm not eager to do it again without having the right supports in place. So all this is to say, I think this is a very worthwhile conversation to have. I think it's an important conversation to have. I think it's worth people taking some time and thinking about it. And if this is a direction the state wants to move in, really planning thoughtfully and thoroughly about how to move forward in that way.
Are there questions of Director Ribson? Or Ms. Ross, do you want to add anything?
Yes, thank you, Senator Bradley. I would just like to include that although there's not a fiscal note attached to the bill at this point, we did provide a fiscal note worksheet, and that demonstrated the complexity of all of the other resources and parts of the department that would be necessary. We anticipate a fiscal note will be attached at some point, but we're happy to provide additional information regarding those details if that's appropriate and requested.
Okay. Senator Whitley.
Thank you, Mr. Chair, and thank you for taking my question, Attorney Ross and Mr. Ribson. So, thinking through your testimony about the benefits and the detriments, I'm curious if you've heard in other states whether this has been achieved within a Department of Health and Human Services, whether it's worth consideration to think about consolidating children's services, but doing so in a way that stays within the funder, which is DHHS and Medicaid.
Interesting question. And top of my head, I can't think of a state that's structured that way. I can think of a county that's structured that way that has really done some of the most remarkable and groundbreaking work in the country, which is Allegheny County, Pittsburgh, Pennsylvania. Interestingly, Allegheny has more people than New Hampshire does, right? So you might be able to think of us as being comparable to a county in terms of, geographically, we were obviously more complex and broader, but there are some similarities there too. So I do think, if that's something to be thought about, there are some models off the top of my head from the county perspective. Not sure on a statewide perspective. I'd have to look more into that.
Further questions? Senator Avard and then Sherman.
Thank you, Mr. Chair, and thank you for your testimony. Joseph, you had mentioned under the heading of detriments that it might jeopardize your federal grants in order to run properly, and I'm kind of rewording it a little bit. Mm-hmm. But how dependent are we on these federal grants in order for this, in order for the Department of DCYF to run properly? And how will this jeopardize that?
Yeah, I think we're entirely dependent on lots of different federal funding streams. Again, other states have done this, so it's possible to break those things apart, but it's a lot of work and effort, right? And it's beyond just the effort of legislatively structuring the right pieces in place. It's going to be effort for folks in the department to realign operations. And again, that doesn't mean it's impossible, but it is a lot of work. And one of the things that I would worry about trying to rush into a process like this is that DCYF is in the midst of tons of transformational efforts that we could spend the next week talking about if folks are interested. And I don't know that I would put restructuring some of those back office things over some of those other efforts that are ongoing at the moment.
Follow up?
Yep, go ahead.
So, I mean, to gingerly head forward, is that your recommendation? Or, I mean, we shouldn't be afraid of hard work, right?
No, I thank you for the question. And no, I don't think we should be afraid of hard work. I think we need to, I think that it's, it would be prudent for folks to think about how to kind of ask these questions and structure these things well, and I think that, probably, trying to stand something up on July 1 is not going to allow for that. I think you need to maybe pull a group of people together to really kind of wrestle with these issues and decide which path New Hampshire wants to go on. I think you can structure workarounds to either of these detriments, right? Some states that have a standalone department also develop something called a children's cabinet, where you have a governor's level cabinet of different agencies that impact on children's services, and they require that cabinet to kind of do this collaborative work that we're talking about, which is necessary, I think, for any department to be functional. Others do that work within the structure of, I think Massachusetts, for example, they have a secretary of human services, but they also have a standalone department of children and families. They have multiple standalone departments that report into a secretary who is the direct report to the governor, and that gives some additional elevation and prioritization to the work, but also allows for that integrative process to work. So I think there's different models that could be looked at. And I guess my recommendation would be, I think it would be prudent for New Hampshire to take some time to really wrestle with those issues before making a decision.
Senator Sherman. Tom, you're muted.
Great.
There you
go. Thanks. First of all, I just want to, again, thank you for your incredible work since you've been with us in New Hampshire. And your experience in New Jersey, how did they deal with the financial side? Was Medicaid, did it stand alone? Was it, was this new department then tied back with MOUs to the Department of Health and Human Services? How did you work that division or that separation?
Yeah, thank you. Thanks for the kind words. And yes, in New Jersey, the way they structured it, and it did ultimately work, but there were some rough patches at the start. Medicaid remained with a Department of Human Services there. It was overall, the state structured very differently than New Hampshire. So the Department of Human Services was much more narrow than the current Department of Health and Human Services here. But they did have Medicaid. They also had developmental disabilities and elder care. There was an MOU that was required, and basically what was required was just really strong collaboration between those two commissioners and their teams to just continue working through the Medicaid issues. We did have our children's behavioral health care system as part of the standalone department at that time, called the New Jersey Children's System of Care. It was really, I think, the division that we're really basing a lot of our current work in children's behavioral health and Senate Bill 14 off of. So it was possible to do that. There were MOUs in place. But overall, what there had to be was a really strong collaborative partnerships between the two departments and a commitment to making sure that remained. And we were able to be successful that way. But there is always a risk, right, over time with new commissioners and new priorities that those relationships deteriorate. And I think that's a risk that needs to be thought about when we think about a restructuring, that there's some way to ensure that risk doesn't become reality, because you could end up with a children's behavioral health care system that doesn't actually have the ties to the funding streams and everything else that it needs if it's not well structured.
Just a quick follow-up. The other concern I have about this is, we are creating an entirely new department. That means putting somebody, adding another commissioner, adding the infrastructure, the administrative infrastructure of a new department. And I don't know if you're the right person to ask, Joe, or maybe Rebecca would know the answer to this, but it seems to me that would increase the overhead of the children's services. And I always worry about increasing administrative costs, where I would prefer to see any financial support going directly to the children or to the programming. Do we have a notion of the delta that this would represent in administrative costs by creating an entirely new department?
Yeah, as Rebecca stated, we did submit a fiscal note worksheet, but it didn't get integrated into the bill. So, you know, at some point that might become available to folks. I don't know, Rebecca, if you can share a little more. It is substantial, though. I mean, there's a lot to stand up an independent department. As I said, there's all those back office structures that currently do not exist to support DCYF separately.
I think we would need to defer to our fiscal folks who also worked on that fiscal note worksheet. But essentially, the way the bill is drafted, it didn't include transferring all of the back office supports. So we had to assume we were building those from scratch and can't completely determine how much would be removed from HHS. So it really being a transfer versus new and additional costs. We can get you the information that we provided in the fiscal note, but certainly for those first couple years, there were substantial things identified, and it would have to do with the details of how those transfers are made and what things do or do not go. And without knowing that level of detail, it's very hard to estimate how much it will cost, but there were substantial costs.
And I would add, I think if there was to be just transferring of staff from DHHS, that's not an inconsequential impact to DHHS, because almost none of those staff are focused exclusively on DCYF. So there are folks who work across, provide that back office support across multiple divisions. So it's not like a clean break that can be made.
One last follow-up.
Yep.
It seems to me that one of the major points of this exercise would be to elevate children to a governmental status that would keep them in the spotlight and make sure that we don't diminish the support that you're currently having, either you or Director O'Neill. Can you think of a way, or do you have any other models from other states that would achieve that goal within your current structure? Is there any place where, whether it's a deputy commissioner level or something like that, that could occur within the current Department of Health and Human Services that would achieve that same elevation, but not create so many divisions, especially on the funding side?
It's a very good question. Off the top of my head, I haven't really given thought to that, so I don't want to just kind of make something up on the spot. But it is it's another thing to think about, right? As we wrestle with this issue.
Thanks.
Are there any more questions? Okay, I have a couple then. I have not read House Bill 2 yet. I understand it came out yesterday, but this establishing a new department was not in House Bill 2, if I'm correct. Is that correct, Mr. Ribson?
Yes, that's correct.
And so let me ask a question. If the goal is a worthy goal to elevate, the department, a new department, to elevate children's services, which I think we all would agree with, I would see that we have a couple of avenues to proceed, but one would be if we were to add a provision into House Bill 2 that created a departmental working group with folks like yourself, the commissioners, Ms. O'Neill, and potentially even advocates to make a report, both a how-to report, how much it would cost, and perhaps most importantly, a recommendation on, do the pluses outweigh the minuses? I think you've sort of expressed that. Would that be I guess, would that be worthwhile endeavor?
Yeah, I mean, my own opinion, I've not discussed this, with others, so I don't want to get too far ahead of myself. But in my own opinion, like I said before, I think this is a worthwhile conversation to have, and finding a place and a space and an avenue and the right people to have that conversation with is worthwhile. So, I think something like that could be worthwhile.
All right. So, I mean, I know how much the department has on its plate right now. And I think all of us believe that standing up Senate Bill 14 is one of the top priorities. So if we were to put something like I just outlined, and I'm thinking out loud, into the budget, into HB2, that would create that kind of a working group of top department personnel, is it going to interfere in any way with what I think we all think is critically important, the standing up of Senate Bill 14? I mean, just in terms of workload issues and that kind of thing.
Yeah, I don't want to speak for the rest of the people who have to be involved with that. I do think that is something to think about particularly in terms of timing of anything like this. Setting up SB 14 is a massive undertaking, but there's also a host of other massive undertakings currently happening at DCYF around transforming our service array to increase the availability of evidence-based models, full implementation of the Family First Preventative Services Act, and a host of other things that take priority for me, because I think they are more impactful to kids and families in the short term than the structure is. But I do think the structure is a long-term, getting the structure right is a long-term imperative for the state. You want to make sure that the gains we make now don't erode when we're no longer the hot button issue.
Okay. Senator Whitley.
Thanks, Senator
You're
Bradley,
muted.
and thank you. Oh. Am I? Do you hear me?
Now you're good. Now you're good.
Okay. Okay, thank you. So the other idea, sort of building off Senator Bradley's idea, Mr. Ripsum, is if we, and because there's so much work to be done to stand up all the reforms from previous bienniums, if we have the Office of Child Advocate sort of convene this work group. I know that you have worked in partnership with her office on some juvenile justice work, and I'm wondering whether she would be the appropriate person to provide some funds to do an impact study, look at other models. She might have access to some national resources. So that's an option, sort of building on Senator Bradley's idea. I'm wondering if that would be agreeable to you.
Yeah, perhaps. I mean, I know that they have a lot on their plate too, implementing their new expansion. There's also existing Commission on Children's Services and some other things that might be, worthy of thinking about whether they're the right place to wrestle with this work. So I think, I think there's different options on the table to place it. I don't want to get too ahead of myself in endorsing one, because I haven't spoken to these people and I just don't feel it's fair.
Okay.
Senator Bradley, I think I saw Senator Avard and Senator Sherman had hands up.
Oh, I'm sorry. Senator Avard.
Thank you, Mr. Chair. And I kind of lost my thunder on it, but just for the general public's interest, when department heads come in and they use words like MOU, what is an MOU for the general public to understand?
Thank you for the question. A memorandum of understanding, which is typically an agreement between different government agencies around shared responsibilities.
Senator Sherman.
Yes, I'm wondering if Director Ripson, whether you, and I don't think you can really weigh in on this, but floating the idea of a short-term addressing this issue of elevating children by putting the division under a deputy commissioner if it's not already, to give it more visibility, more prominence within the department. But then also, rather than doing a working group, which could potentially take people away from the critical work they're doing on SB 14 and the work that Maura is doing, as you've described and that you're doing, and having a congressional, I'm sorry, not congressional, legislative committee that would do this look at what is the best legislative solution or statutory solution. I'm worried that we might be jumping in a direction that would create more overhead, more cost, divert funding from programming, and also artificially separate children from all the other services, as everything else we're doing is moving towards a more integrative, comprehensive model. So I guess my question would be, what would be your thoughts on within the department being able to elevate children's services in some way, at least as a short-term measure, but then thinking more long-term with a study committee. This bill could be turned into a study committee, and that work could be done fairly rapidly to look at the structure of the department without pulling people in the department away from the work that they're already doing.
Yeah, thank you for the question, Senator Sherman. I think I prefer not to just opine on some of that stuff without having the opportunity to speak to my colleagues about it. I am here speaking on behalf of the department and stuff, but
you are a wise man. Okay, Senator Whitley.
Thank you, Mr. Chair. Thanks, Mr. Rosen, for taking all of our questions. We really appreciate it. I think this is a fruitful conversation. So with the deputy commissioner idea, I know that Commissioner Tappan, Chris Tappan, had held that position before, and I'm wondering if she has been replaced since she left the department, and was her focus, as Senator Sherman described?
So I believe the structure when Associate Commissioner Tappan was here was that she was an Associate Commissioner for Human Services, and she oversaw the divisions of DCYF, long-term care, or long-term supports and services, behavioral health, and economic and housing stability.
And has she been replaced?
No, I believe the position is posted, although I'm not 100% sure on that.
Okay, further questions? Seeing none, I think Senator Whitley would like to ask Maura O'Neill further questions, if that's possible. Thank you very much, Joe and Rebecca.
Thank you.
I'm not sure which one is Maura O'Neill. I do see two attendees labeled New Hampshire Child Advocate, so I don't know which one.
Here comes one.
There we go. Okay.
Thank you. Maura O'Neill for the record.
Well, thank you, Mr. Chair, for allowing me to ask additional question. I just wanted to ask about this capacity issue that was raised. Of course, everyone, I know your office has just expanded, you know, would you have additional capacity? Would it require additional funds to do this kind of impact study, this review of other models that we're talking about today?
Thank you, Senator Whitley, for the question and for the vote of confidence. It certainly is the kind of undertaking that's absolutely appropriate for the office. We are stretched. We have asked for new positions in the current budget, and that we're not confident that we'll get. So an undertaking like this probably would require a small amount of funds to bring in consultants to help drive this sort of coordinating of those efforts. Probably not a whole lot, but I don't think that we could guarantee that we could do such a project without a little help.
Further question?
That helps. Thank you.
Thank you very much.
All right, Griffin, is there anybody else who wishes to speak?
Representative McKay has raised her hand wishing to speak.
Okay. Good morning, Mary Ellen. How are you?
I'm fine, Senator Bradley, and how are you?
Good.
Well, good morning, Senator Bradley and fellow committee members. My name is Mary Ellen McKay, and I am a former state representative. And in that capacity, I chaired, one of the committees I chaired was the Joint Legislative Committee to Review and Examine DCYF. I also chaired the Committee on Foster Care. And during that time, facilitated taking a group of individuals to include Judge Ashley, Senator Carson, Senator Feltes, Senator Martha Fuller Clark, and now Senator Hennessy, Representative Don LeBrun, Moira O'Neill, Joe Ribson, and myself to New Jersey, where we studied the New Jersey system of care. And then we brought New Jersey back to New Hampshire so that New Jersey could talk to people here on the ground and everyone could learn what we were hearing at the time. And I still believe, New Jersey had one of the best child welfare systems in the country, and they had separated out children's services. It seems that this bill is carrying on the work that happened because of Senate Bill 14, which occurred because of that trip to New Jersey and bringing New Jersey here. Everyone learned, and we keep continuing to move forward. I watched the courts as they move forward. I watched developmental disabilities as they move forward, and children's voices seem always to be getting lost. Our future is in our children. And if we don't think about our children today and plan for tomorrow, there will be no future. And they are the voices of tomorrow. I think they need to be heard. And I think they need to be counted. What happens is in any system, the squeaky wheel seems to get the oil, but children don't become that squeaky wheel until we have lawsuits. And lawsuits cost more money than it would take to try and restructure, refigure out, and transform the systems that we currently have. We all know that. Just like vaccinations protect against certain illnesses, preventative maintenance protects our vehicles. We need to do preventative maintenance on ourselves as humans, but mostly as children. And so I fully support this. I was glad to hear Director Ribson mention Families First. Families First federal legislation is going to change a lot of things in all states, not just New Hampshire. One of the things that it'll change is there's a Model Foster Care Act that needs to be followed. And as the current executive director for the New Hampshire Foster and Adoptive Parent Association, I listen very carefully to voices of foster parents and of former foster children, as I did in those two committees. This is a very necessary and needed experience for New Hampshire. New Hampshire generally is at the top of the heap. We're always first. And I don't think we should stop that forward progress. Developmental disabilities learned with their area agencies how to structure a system. I've been in that field for numerous years. There's an awful lot that children's services can learn from already established services and supports that the DD community enjoys. And so I will conclude by saying this is a very, very worthy piece of legislation. Study it, bring it forward, whatever we need to do. We need to support children so we stop having lawsuits and we stop having children whose voices get snuffed out, and then we get smart. And thank you for your time and for listening.
Thank you very much, Representative McKay. Are there questions? Great. Good to see you again. Thank you.
At this time, Senator, I do not see any other hands from anybody else wishing to speak on this bill.
All right, I am going to close the hearing on Senate Bill 159. All right, this is what I'm going to propose that we do. Let's take a 5-minute break, come back at 10:35. I will text John Williams to see if either of the two witnesses on the prior bill are available. If they are available, we'll go right to them. If they're not available, I still will reopen the hearing on Senate Bill 156, and we'll recess it again until next Wednesday, and we'll reopen the hearing on 156 for the purpose of hearing from the department. Does that make sense to everybody? In fact, why don't we say 10:40 to give everybody a little bit longer break? Is that all right? Okay, we're going to be in recess till 10:40. Thank you all. Okie doke. Griffin, are you there? Just, I'm told that Miss Moquin is ready to go. So as soon as Griffin.
Rule of law actually applies.
Whoops, what was that?
I can bring in Miss Moquin.
Okay, all right, so
Here we go. Okay.
I'm going to reopen the recessed hearing on Senate Bill 156. Ms. Moquin from the Department of Health and Human Services is here. And I think Ms. Moquin, Senator Whitley wanted to ask you questions on 156.
Yes, thank you, Mr. Chair, and thank you, Ms. Moquin, for joining us. We're sort of going back to the bill related to secure psychiatric unit, and my questions were around, well, I would like sort of the department sort of take on this model that has 25 beds, you know, the ability to look towards other providers outside the department, and sort of this issue that Senator Sherman raised about management of the facility versus operating the facility, and if the department, you know, concurs with the model contemplated in the bill. So there's a lot there. I apologize.
Okay. I'll do my best. And what I can't answer, I'll certainly take back and provide you with in the future. But I think the overarching sort of idea behind this is the idea of having mentally ill patients, forensic patients, receive care at the right level of care and the right level of security in the right location. So this idea is that Health and Human Services, you know, if we were able to build this forensic hospital, there would be utilization of patients who are not guilty by reason of insanity or incompetent, and then also patients potentially who are mentally ill and haven't been adjudicated yet. So there's a lot there and a lot of detail that we need to work through around that. Within that idea of the person being at the right level of care, I think the department's vision is that there would be different levels of security, there would be different levels of programming, and that patients would work through this system with the goal of, you know, recovery and ultimately returning to the community if they were able to. So that's sort of the overarching premise behind this. I mean, right now that happens through some different silos of care, as I think you all know, whether, you know, it be at the state prison or patients that come here to our forensic unit here at the hospital. But the idea would be that the department would have really more oversight of the entire program. Does that answer your question?
It does a little bit. I think I'm looking even for more granular response about, you know, capacity, because we don't want to underbuild, we don't want to overbuild, right? We want to make sure that those levels of care are flexible, but of course that folks are getting what they need in the community at the right time also. And so if you have a better sense about what are the numbers of those folks who are NGRI, civilly committed, you know, what's the estimate of what we would need right now?
I would say that, you know, my opinion is that 25 beds would be far too little to really be able to do a program like this justice. We have, at this point at New Hampshire Hospital, we have a 24-bed forensic unit that we're utilizing for folks that are not guilty by reason of insanity or incompetent to stand trial. So that's 24 people that are here at our hospital. And, you know, if they were in other programming or in a facility like this, that would certainly open up an admission unit here at the hospital. And again, have a pure forensic program that is in a separate building here on the grounds. So there's that population of people. And then there's the population that is at the state prison right now, utilizing the services at the SPU. And I'm sorry, I didn't hear the testimony by the commissioner from Department of Corrections, but there are 50 to 60 patients at any given time that move through that programming, is my understanding. So there is a population there as well. I think where we have to get really, and you said granular, I think is a great term for that. What we have to really identify is scope of what would be the absolute scope of this forensic hospital, because right now the SPU at the state prison, yes, they work with patients that are NGRI and you know, not and incompetent, but there are also patients that utilize that service there who are adjudicated inmates at the hospital that have an acute need. So that's a population, I think, that would still be served at the hospital. I'm sorry, at the prison. But then we need to also consider inmates throughout the correctional system. And by correctional, I mean county correctional system, that have an acute psychiatric need. So at any given time here at New Hampshire Hospital, we have, you know, 5, 6, 7 correctional inmates that are referred here as well. So I think that the numbers are there, certainly over 25. And I would, you know, in my estimation at this point, would say more like, you know, 60 or more beds needed in that forensic hospital.
Follow up?
Senator Whitley.
Yep. So I'm just trying to distinguish between, you know, those folks that, you know, already have, they're serving their sentence and need care at the current SBU, from those NGRI folks and civilly committed folks. And so we're getting sort of conflicting evidence about that. So if you were, I mean, I'm wondering if the department has conducted an analysis, you know, I would love to see those numbers sort of split out historically of NGRI folks, civilly committed folks, and folks that, you know, need the care in the SPU that are already committed to the Department of Corrections. Is that an analysis that's been conducted, or is that an analysis that could be conducted and forwarded to the?
I believe it has been conducted, but how recent that data is, I'm not sure. We can certainly update that in real time and get that to you.
Great, thank you.
Sure.
Further questions, Senator Sherman.
Yeah, thank you, Mr. Chair, and thank you, Heather. I'd like to get back to 156 a little bit more. To be clear, did the department request this bill?
I'm sorry, I don't know who made this request. Maybe John Williams can answer that question.
So, John, are you on?
Yes, Senator Bradley and the members of the committee, this was not made at the request of the department. It is actually based upon a bill that was tabled last session, did not make its way through the pandemic. And given the scope of the legislation in terms of, you know, restricting or prohibiting for-profit construction, you know, that was our understanding of the focus of this bill. And that's why I brought to your attention earlier today that there's also a provision currently in HB2 as introduced that deals with the issue of around standing up a secured psychiatric unit. Certainly, this has been very rich in terms of the types of bills. And I know, Senator Bradley, you've been involved with this for some time, as well as Senator Sherman. It was part of your time as well. And so I'll stop with that. With the answering of the question is, was it requested by the department? The answer is no.
And so I guess a follow-up question is, and I'm not sure if this is for Heather or for John. The current statute actually already prohibits for-profit and private prisons from participating in the process, doesn't it?
Yes, and Senator Bradley, that was what I expected our testimony to be, given the four corners of the bill in front of you, is that it's already, a provision of law. At least that's my understanding, Senator Sherman.
So this one might be for Heather, if I could do a follow-up, Senator Bradley.
Go ahead.
Yeah, I guess the big question is this necessary?
If I could just jump in just for a second, Senator Bradley, the financial officer, Joe Christie, and myself testified last session on this legislation, or provided information that it would not be necessary. So at least consistent with what we testified to last year, we would repeat that testimony this year. I'd also invite our Chief Executive Officer, Moquin, if she had any other insight that she'd like to provide.
No, I don't think so. Thank you, John.
So one last question. I think this one is for Heather. When I think I don't want to, we have debated the size of this forensic hospital ad nauseum back in the budget process last year and prior to that. And I think people like the Disability Rights Center were very concerned about it being too large, as were other advocates. And so I would like to stay focused on this bill because one of the things that Paula Mattis testified was that they currently have the ability to, and in fact already do have a contracting agreement with Dartmouth-Hitchcock providing psychiatric services within the SPUE, the Secure Psychiatric Unit. There would be nothing in existing statute that would say that the department cannot go out and contract with an appropriate psychiatrist or psychiatry group or facility that could provide psychiatric services. Is there?
I don't think that there's anything that prohibits that, no.
Okay, thank you. That's all.
So just to review on the question that keeps coming up by Senator Whitley, I was the prime sponsor in 2019 of Senate Bill 291. As I think Senator Gray and Senator Sherman both remember, it passed with an amendment out of the Health and Human Services Committee. It went to Finance, was laid on the table to be put into the budget. I just read the text of the bill. It was a 60-bed unit. There was a lot of opposition, as Senator Sherman and Gray will remember, to that proposal in the House. The compromise that finally came through the budget, which is what's reflected in Senator French's bill 156, was 25 beds, 8.75 million. Okay, so that's where we're at. Whether it should be larger or smaller, that's the background of the debate that happened 2 years ago. Okay. All right. Are there any further questions of Ms. Moquin or John Williams? Yeah, go ahead.
Yeah, just a very quick clarifying question. You mentioned that is in 156, but that is actually already in statute. Could be in the budget as the governor would like to do, but it's already in statute. So 156 would not be necessary to keep us at status quo right now because it's
In
already.
terms of the bed numbers, that's correct.
Okay.
Obviously, the purpose of the bill is to limit the type of providers that, can participate in building and operating this 25-bed secure psychiatric unit. Yeah.
So, and I don't want to sound like I'm getting into executive session, so I'll ask John Williams this question. This bill 156 would actually expand the type of provider from what is currently in statute by the actual wording. Is that not correct?
I never do well with double negative questions at the very end there, but my understanding was from our fiscal analysis on the bill that we did believe that it was not necessary, but I'd have to take a second look because I think your question here is certainly a thoughtful one, and we can get back to you before you take executive session on this bill, Senator Bradley. We can get back to you even faster.
You can get back to me, but I think the clear reading of the legislation, Senator Sherman, is absolutely correct. If you look at line 14 on the bill, it's pretty clear. That's what's being crossed out. Shall not enter into a contract with a private or for-profit company for the construction or operation. And then further on line 15, it says, reiterates again that it shall be the responsibility of the department. The department may contract with private psychiatric service providers, okay, but cannot enter into a contract. So Senator Sherman is correct, in my opinion, that it does expand the potential providers that could manage this 25-bed facility.
And Senator Bradley, thank you so much. I didn't have the language up in front of me. So I would concur with the brilliant wisdom of both you and Senator Sherman on that point. And certainly, thank you very much, as always.
Okay. All right. Are there any further questions? All right. I am going to close the hearing on Senate Bill 156 and thank everybody for their testimony this morning. So before we get to a motion of going into executive session, we're going to take one moment of personal privilege to give Griffin and Kirsten a real big shout out for the work that they're doing, keeping all of us on track. Kirsten in particular is brand new to this process, hasn't met, I don't know, maybe you've met some of us, hasn't met me, because I haven't been in the building since I think late November. And I just wanted to make an offer available to committee members that Kirsten will walk anybody through how to use the OneDrive that is actually very, very helpful. So if there are any questions, obviously do it offline, one at a time with Kirsten. She will be thrilled to do it. But again, I can't thank Kirsten and Griffin enough for their great work. So that's my personal privilege. So would somebody like to move executive session?
So moved.
Second.
Seconded by Senator Gray. Okay, so it's been moved by Senator Avard, seconded by Senator Gray. We'll call the roll. Senator Sherman?
Yes.
Senator Avard?
Yes.
Senator Gray?
Yes.
Senator Whitley?
Yes.
And I vote yes too. All right, so let's have a couple of minutes of discussion on a couple of these bills, and then we'll get to the bills that I think we can actually take action on. So my recommendation on Senate Bill 156 is to have Senator Sherman bring in an amendment that he discussed, create an amendment for accreditation of these potential new service providers. I think that Tom made a really good case about HCA doing an excellent job of, you know, some of the behavioral health services they offer. So I don't think we should be limiting, you know, who can run it, but obviously it has to be accredited. Is that seem like a reasonable approach for everybody, Tom?
Yeah, I'm happy to do that. What I'd like to do, if it's okay with the committee, and looks like Senator Whitley has some input too, but I would like to sit down with the department on the current language in statute and make sure they're comfortable with that, and that allows them the flexibility they need to provide staffing, especially psychiatry and mental health staffing at the unit. Whether that, and then there's the second part, which I really want to talk to probably Melissa Sinclair or one of the people over at the department, is whether it would make sense to do that accreditation and make that a requirement for the forensic hospital. I remember we talked about this.
We did.
In the past, and we also talked about that there is a component of the admission that's reimbursable by Medicaid. And it's not insignificant. It's something like the first 120 days or something like that. So I just wanted to go over with the department those two things, and with the indulgence of the committee, come back. They may say they have the ability to do all of that already in statute, in which case my vote would be to ITL. But if there is something that they need additionally to achieve those goals, which are appropriate flexibility in contracting and accreditation, then I would like to put that in the amendment and move forward. Does that sound reasonable?
Does to me. Senator Whitley?
Yep. So I mean, in some ways, because this reflects the agreement from the last biennium and a whole host of work from advocates, it does make sense to me to actually pass this version, because it does sort of bake in an appropriation commensurate with what folks think is appropriate in terms of capacity. And I absolutely agree with adding this accreditation piece. And I'm wondering whether that would adjust the appropriation, because we heard it does cost to do this accreditation, or whether that cost would just be, you know, borne by the whatever provider ends up doing this.
Okay. Is everybody okay with this approach? We have a couple of weeks. When's our deadline to exec this bill, Griffin? The 24th or the 31st?
Give me 1 second here. I'm sorry.
Well, Griffin's looking that up. I just don't want to turn this bill into an FN bill. So right. You know, whatever you do.
I agree with that. I think
I agree 100%.
Even though I didn't think it was the best decision of 25 beds, that was the compromise that got, you know, through the process last year or 2 years ago. So I don't think we should be, you know, changing that bed requirement at this point. That's not the purpose of the bill, and it would be a major deviation and having, I mean, as I recall, my bill last year had a price tag of around $27 million. So any rate.
So Senator, real quick, if we're talking about Senate Bill 156, the bill should be exec by the 24th of March because the deadline to act on all Senate bills is Thursday, April 1st.
Yeah, okay, that's what I thought.
Yeah.
All right, so
Can I just say one more thing about that?
you got plenty of time, Tom.
Yeah, so thank you. So I agree that, right, the FN piece, should be in a different place, but I think the conversation about capacity is a policy issue, right? That is important for this committee to continue to discuss, because we're talking about the needs of Granite Staters and then our most vulnerable Granite Staters. So I think that capacity question is worthy of a policy committee.
I'm not disagreeing with that one bit. It's just, the way that should be part of the discussion that we're going to have in April when we're working on the budget. And if there is a need for an adjustment, then that's something else again. Okay, so we'll hold on that bill. All right. Let's have a brief discussion on 159. I think a lot of good points were raised. I think Senator Carson would obviously like this bill to go forward, but a huge number of questions come up. I don't want to take action on it today and give her a chance to see the hearing report and react to it. But I think it is something that probably re-refer or ought to pass and table, or re-refer and table is appropriate, but we'll see. Is that all right, Tom?
Yeah, can I just ask a question about moving forward? I think the question is a great one. The question it raised, or the questions about how to make sure that the kids' needs stay front and center. And of course, that's been Senator Whitley's baby for a long time. So the question I would have is, would there be a third option of either a study committee that, potentially Senator Carson could head, that would look at all these issues? Because, I think her heart is with the kids and she wants to do this, but I also know she probably shares some of my concerns about administrative overhead and increasing size of the albatross of government and all that kind of stuff. So anyway, that's just my thought of whether that might be a third option for this bill.
Yep.
If I may, I probably take just the opposite of you. I think it's more kicking the can down the road. And I think if Senator Carson were probably here, she would say probably the same thing. There might be some concerns that she'd want to address, but I don't feel like we should prolong this. I think that with the whole concept of competing interests and people that don't get to compete are the kids, and they get lost behind and they get left behind. And I feel strongly about that.
Okay, well then, go ahead, Tom.
Yeah, I of course have been, and I'm the son of a child therapist, so I completely agree with the kids being very vulnerable, but I also would wonder if there is a way within the current department structure to achieve the same goal without creating artificial silos and barriers to an exchange of information and the financial support.
If I may too, I think it's very clear, and it's actually incredible to see such broad support for heightening the attention to children. Like, I think that's incredible that this committee is on the same page for that. I think we want to proceed in a way that puts that, top of mind. And so any change, would want to contemplate all the ramifications and with the goal of keeping children at the front. So I think it's worthy. I mean, I'm not sure whether, making this bill into a study or, working really hard to get some amendments to make it something that everyone's comfortable with. I don't think we're ready to decide that yet. So I think it is helpful to let Senator Carson, view the hearing. Maybe she could have some conversations with the Office of Child Advocate and we can go from there. But I think we can all agree that, elevating children, and we can use this bill as a vehicle to do that this session.
Okay, so we'll continue the discussion on that bill next week. So let's go through some of the other bills. I have not heard back yet from Senator Prentice on Senate Bill 75. We were holding that. She was trying to find a non-legislative solution, which we all encouraged her to do. I am not sure that that has happened. Senator Sherman, on Senate Bill 74, do you want to give us an update of where you're at? I know you've been working really hard on it.
Yeah, so Senate Bill 74, the update is that we had an amendment that was agreed to. First of all, I want to thank that we had 30 participants and almost 7 hours of meetings in group meetings, and then the group split up and went and worked on this amendment. It's a phenomenal document, but there is still a group out there that is has big concerns with that amendment. So as I mentioned to you yesterday, Mr. Chair, first of all, the amendment is not quite ready yet. And then second of all, it sounds like we need to jump back and see if we can find a quick resolution to those concerns by that one party. So hopefully we'll have it ready for you next week in some form.
Okay. Obviously you have until the 24th, so.
Right, we are on it.
Okay. Senate Bill 121, this was Senator Rosenwald's bill. I think the way that we had left it was that we were going to wait until the 24th before we exec it to hear if there was an initial recommendation from the Department of Insurance. Senator Rosenwald approached me over the break with a concept that we may want to consider, and I can ask her to circulate the amendment that she is working on. Basically, it would lift the prohibition on a state-based health exchange. So that would allow the Department of Insurance and the governor's office to move forward with a health-based exchange if they found it to be in the public interest. I suggested to her, as she thought through this, to put some conditions on how that decision would be structured. Would it lead to lower premiums? Would it lead to better access, better information sharing? Would it be manageable, easily managed by the state? All those questions that came out of the hearing. So I think she's working on that amendment. I'll circulate it, and then, we can have a discussion on that again, even because I suspect that by the 24th, we're probably not going to get a comprehensive answer from the Department of Insurance. Okay, moving down the list, I think the next bill that I hope are ready to take action on is Senate Bill 140. So does everybody have the amendment that I circulated? It should be 0573. And that amendment deals with Senator Rosenwald's piece in the appropriation that dealt with homeless services. As you recall, she had an appropriation of $18 million for the biennium for these services that were going to be general fund expenditures. I suggested in the hearing that we add language which is reflective on lines 13 through 15. And that is that this appropriation be made from general funds. So general funds, federal funds with an F, sorry. Who knows what's going to happen with a stimulus bill that comes out of Washington. It, in my opinion, looks like it's a distinct possibility. So that was where I thought that the funding should come from, because $18 million as a general fund appropriation is pretty significant. I think that there was some question about potentially changing the definition of the services. I suggested to Senator Rosenwald in an email exchange late last night that if that was necessary, this bill will go to finance and that change could be made there.
Move out to pass on the amendment.
I'm just wondering if we want Senator Rosenwald to speak to it at all.
If she's there,
Maybe
she
she
can.
doesn't.
If she's here, she can. I have no problem with that.
I do not see her in the attendees list.
I mean, she got back to me, Senator Whitley, this morning. Let me see if I can find her email.
She just texted me that she's okay with this change.
Okay. All right. And again, if there is a need for a definition change, somehow, it's going to go to finance and be able to make it there. All right. So
Okay.
Senator Avard has moved Amendment 0573.
All right.
Whitley second.
Seconded by Senator Gray. Is there any discussion? Seeing none, I'll call the roll. Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Whitley,
Yes.
and Senator Sherman.
Yes.
And I vote yes too. And I would just note that Section 2 of the bill, which was also Senator Rosenwald's bill that deals with prevention services, is not changed at all. All right, so the amendment has been adopted. Is there a motion of ought to pass as amended?
So moved.
Second.
Senator Avard is moved, seconded by Senator Sherman. We'll call the roll again. If there's no discussion, Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Whitley,
Yes.
Senator Sherman.
Yes.
I got everybody, and I vote yes. All right, Senator Sherman, you want to take this one out?
Sure. Are we going consent?
Oh, yeah. Senator Sherman has made a motion for consent.
Second.
Third.
Fourth.
Yeah, we can do consent on, even though it's a fiscal note bill. It's only finance that can't. That's right. I was just questioning in my mind. All right. So the motion has been firsted, seconded, and thirded for consent by Sherman and by Gray and et al. Senator Sherman,
Yes.
Senator Avard,
Yes.
Senator Whitley,
Yes.
Senator Gray,
Yes.
and I vote yes.
Senator
Okay,
Bradley,
the next,
Senator Prentice is available to speak to SB 75.
sure. Hang on a
I'm
minute.
sorry, who is taking out 140?
Senator Sherman is going to do that.
Thank you.
Yep. Okay, there we go. Good morning, Senator Prentice.
Good morning, Senator Bradley and my colleagues on the Health and Human Services Committee. Just an update on Senate Bill 75. So on February 18th, Health and Human Services said they're in the final discussions, and their current estimate for turning this on so they could see the community total and the school total is March 4th. That is their estimate for when this will happen. So they're in their final discussions. I don't know, Senator Bradley, I want your advice on the best way to proceed. I feel this has all been more than in good faith and that this will happen. And they've even demonstrated it for me.
So, Senator Prentice, what if there were a motion to re-refer the bill? If everything goes as anticipated, there obviously will be no need for the bill, but we would retain it if there is a need for the bill. Would you be okay with that?
I would be appreciative of that. Thank you.
Well, I like appreciation.
So moved then.
All right. So Senator Whitley has moved appreciation of Senator Prentice's bill, Senate Bill 74, no, 75. And it's seconded by Senator
with
Sherman.
much appreciation.
Much appreciation. Okay. Thank you, Senator Prentice.
Before she leaves, can she stay on for 123?
Yes, sure. Of course.
Oh, yep. Sure.
Okay.
Do we need to take a roll
Okay,
call?
I'm sorry. So we're in the voting mode. The motion has been re-refer for study. Senator Sherman.
Yes.
Senator Avard.
Yes.
Senator Gray.
Yes.
Senator Whitley.
Yes.
Okay, Senator Whitley, you may, make a subsequent motion, and then I'll assign you to do the blurb.
Consent.
All right, so Senator Sherman has moved consent.
Okay.
Senator Gray has seconded with his smile. All in favor, Senator Gray.
Yes.
Senator Whitley.
Yes, and I appreciate Senator Gray's smile.
Senator Sherman.
Yep.
Senator Avard.
Yes.
And I vote yes too. So I think I assigned it to you, Senator Whitley, to do the blurb.
Sure.
Okay, I apologize. I was going in numeric order, but I couldn't even read my own writing. Senate Bill 123, we have an amendment 0414.
Can we put that up on the screen?
Sure, go ahead.
1 second.
Yep.
I'm just making sure Griffin's awake there.
Yeah, okay.
This is where Griffin and Kirsten just earn every penny of their salary. If I thought I could do this, yeah, well, I'd be lost.
So this is super simple. If I could just speak to the amendment, and Senator Prentice, actually, if you want to speak to it, because it's sort of rewriting your bill.
I'd be happy to speak to it. So we, Senator Sherman and I met with a stakeholder group and representatives from the industry, and we actually looked at language that was already in statute, calling any of these types of requirements unlawful, and actually brought that over to be consistent with the language that's already on the book. So instead of making it, so basically we're just staying in line with what's already in the law and adding COVID to it.
Yeah, and I would just add to that, that if you all recall, there was an FN, this Senator Prentice's bill was 132, I think. And there was an FN attached to that based on the original wording, because the original wording required the employer to pay for the testing, which meant that current arrangements where the employer was sharing that cost all came down to the employer, which gave, I think it was a $10 million FN. This gets rid of all of that. This just says, this is consistent with the intent of Senator Prentice, but it doesn't require the employer necessarily to pay for it, but it does make sure the employee will not pay for a required test.
And just so everybody knows, during the break after Senator Prentice and Senator Sherman sent this amendment, I ran it by a wide array of stakeholders, business groups, the Department of Insurance, industry, insurance industry folks, and everybody came back to me and said, good to go.
And just to remember that the original bill, SB 123, which was mine, I'm a big believer in recycling, so it has gone to the recycling bin as Senator Prentice's new bill. So if you were wondering what happened to SB 123, it had a number of problems, and this is a good resolution of the original 123.
Gets us where we need to be. Yeah.
Okay, so I think Senator Sherman is making a motion on Amendment 0414 of,
Second.
Ought to pass.
and Senator Whitley has seconded it. Is there any further discussion? Seeing none. Senator Gray,
Yes.
Senator Whitley,
Yes.
Senator Avard,
Yes.
and Senator Sherman,
Yes.
and I vote yes. Is there a subsequent motion of ought to pass as amended? Moved by Senator Sherman,
Second.
seconded by Senator Whitley. Any further discussion? Seeing none. Senator Sherman,
Yes.
Senator Avard,
Yes.
Senator Whitley,
Yes.
Senator Gray.
Yes.
Is there a subsequent motion of consent?
Moved.
Second.
All right, so Senator Gray has moved it. It's seconded by Senator Sherman. Senator Whitley,
Yes.
Senator Gray,
Yes.
Senator Avard,
Yes.
and Senator Sherman,
Yes.
and I vote yes also.
And I can take it out if you like, Mr. Chair.
Okay. So we've done those two. All right, so the next one is Senate Bill 144. And I would recommend a motion of re-refer. This bill came with a lot of support for good reason. Child care scholarships and helping people that need childcare is a really important thing, but it also came with a huge price tag that I think would be very difficult to fit into the budget. After the hearing, I had a long discussion with Christine Santiello from the department who testified. And she said several things, but in particular, why I think we should re-refer the bill is that in House Bill 4 in the 2019 session, so the budget trailer bill, there was a provision that created in the Department of Health and Human Services a study committee or to create a plan to close the cliff effect for people who get public benefits. And Senator Rosenwald is on that group that's working on this. There are a number of different components to it. They expect to, have a report by March 22nd, and they anticipate multiple recommendations related to childcare. So if we re-refer this bill, and actually then when it gets to the floor, it could be tabled for consideration of not only the pieces in this bill, but what may come out of the report that was triggered by the trailer bill 2 years ago. So that would be my recommendation.
My recommendation would be because this is a policy committee and there are so many questions around the fiscal note. We heard strong testimony that fiscal note was not reflective of the actual change. And we heard that from multiple folks who work in the system. And so because this policy, we heard from a whole host of folks, would help families and would help stabilize a struggling childcare industry right now. So right now we have families that can't access childcare, and right now we have childcare centers that are going to shutter. So we are in a critical and emergency point right now that we need to take action. And so because we are a policy committee, this is good policy. We heard from dozens of people, plus we had 500 people sign in support of this policy change. It's a small policy change. That's what this committee's for. finance can deal with the fiscal note because there's a lots of discussion about whether that fiscal note is actually accurate. And, there was some testimony that it could actually be cut in half or even 2/3 or drastically reduced if the stakeholders got together and had the conversation. So again, this is not something that we can wait on. This is an emergency situation. Families are desperate, and childcare industry is desperate. If we don't do something now, how are we going to get our economy back up and running? Childcare is an incredibly important workforce issue. We can't get people back to work if we don't have childcare for working families.
Not disagreeing with anything you've said. The department, though, did not testify that the fiscal note was incorrect. There was other testimony. I think that re-refer would be a better motion, especially in light of the fact that the group that Senator Rosenwald is on is going to make a recommendation by the end of March, which is timely for consideration of the budget. And it's probably going to have broader policy recommendations than just what's in 144. But there'd be no reason why, if this group has recommendations contained in 144, the Finance Committee couldn't consider them with a re-refer motion. But it just, I think it allows the process to work better. So
I just wanted to speak to that issue. I respect that group, the work that group is doing, but I think we heard testimony from a lot of other folks, plus the 500 people that signed in, over 500 people signed in, that this policy in particular has risen to the top as necessary. Okay. And so, I see that I hear the concerns of waiting for this group, but because this policy has such broad support, it's a simple change. We can work on the numbers. It doesn't feel like something we can delay on.
Okay, fair enough. Senator Sherman?
Yeah, I fully agree with Senator Whitley, and I would propose, because we agree with the policy and there are questions about the fiscal note, we're not trying to decide on the fiscal note, we're trying to decide on the policy. So I would prefer that we move this along with ought to pass and either send it off to Finance to look at, and if they feel that the fiscal note is too expensive, then it could be stopped at Finance. Or, but in the meantime, Senator Whitley has talked about being able to look at the fiscal note with more detail and work with the department to see if it could be updated. But there would always be the option to table if it does turn out to be too expensive, and then be brought back off the table and reworked for the budget. But the message we're sending by re-referring or killing and not passing is that we're not listening to those 500 people. We're not recognizing that we're in the middle of a crisis, and we are I have a concern about that. So I would not support a re-referral at this point. I support the policy, and then I would ask fiscal or finance to look at the fiscal note very carefully so that we can be sure it's correct, especially since there's questions about it raised by Senator Whitley.
I support a re-refer.
Okay, I'm going to recognize Senator Gray. Go ahead.
One of the things that I don't understand about the bill is when we look at page, I guess it's page 2. And I'm starting at Roman 4, line 10 down to 17, where it talks about attendance-based enrollment vice, other things. And then we get down into line 17, and what we do is we say that this is only for those 2 fiscal years. And so if it's a good thing to do, then why is it a good thing to do for those 2 fiscal years and not a good thing to do for other fiscal years? And therefore, the way the bill is right now, that confuses me entirely. And, I can't support anything but a re-refer because I think it needs to be looked at.
Thank you, Senator Gray. And I can address that. So that portion is just because that's how we have to, as a state, administratively deal with the federal government. So that provision in there is only administrative. And say we pass this and we make this change for 2 years. So this is required by the federal government to do this report. So say if it doesn't work, we're not seeing what we are intending to do with this change, we can make the change in the next plan. So that's a possibility. So I'd like to move ought to pass.
All right, Senator Whitley has moved on to pass. I think it's seconded by Senator Sherman.
I already made the motion for re-refer.
Kevin, I'll recognize you in a second, I think. So Kevin, would you withdraw your motion?
So moved.
Okay, so the motion right now is ought to pass. Everybody clear on that? Senator Sherman,
Yes.
Senator Whitley,
Yes.
Senator Gray,
No.
Senator Avard,
No.
and I vote no. The motion fails 2-3.
Move to re-refer.
So now Senator Avard has moved re-refer. Is there any further discussion? All right, the motion is re-refer. Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Sherman,
No.
and Senator Whitley,
No.
and I vote yes. So the motion is 3-2 re-refer. I'm going to assign Senator Gray to take that out. Okay, let's go to Senate Bill 150 first. And I have an amendment 527. What that amendment does, it's on
Which bill did you say, Senator?
the Medicaid dental benefit, Senate Bill 150.
Thank you.
So this is Senator Rosenwald's bill. Several of us have co-sponsored it. I think it's really important that we have a chance of getting this passed. And the only change that this amendment makes is to move back the date of procurement to January 1, 2023 for the adult benefit. That's on line 9 of the bill, and it would replace line 28 of the first page of the bill as introduced. So it makes that one change. So the fiscal note on this bill had a estimation of about $7.5 million of general funds. I don't know where my fiscal note went. I apologize, but that's my memory. Much of which is traditional Medicaid, and then some of which, because of the 90-10 split, for Medicaid expansion. I spoke with Dr. Finney, the Medicaid director, who indicated to me that the scope of the benefit is pared back about as much as it can be to still render it worthwhile in terms of what services are covered. So in an attempt to make sure that this bill passes this time, I am proposing that we move back the date by those 4 months from September 1 to January 1. And that should get the cost in the budget that we're about to be debating to less than $2 million, because there's a 3-month lag between the January 1, 2023 date of implementation until the time the benefits start. So it's about 1/4 of one fiscal year. I hope that that is something that we can all support, and something that we can convince our friends on the Finance Committee to support because of the relatively modest dollars in this budget. But I think, as we've all experienced the testimony that we've heard for some time, there is an overall health benefit. And while it's hard to quantify it, it has the impact of reducing Medicaid costs from covered services like diabetes and other things that result from poor oral health. When I broached this change to Senator Rosenwald, she indicated she was okay with it, and there you go. Senator Sherman.
I was just going to second what you just said, which was I did talk to Cindy about this and she's fine with it. And the other is I just had a question, Senator Bradley, about, we had that email from Delta Dental, and I think their estimate was that it would come in under the cost that the fiscal note, I think it was about, I don't have it in front of me, but I thought it was in the 6 million plus a little bit range. So there may be additional savings that are not reflected by the note.
Well, again, I think that by the, because what I'm going to recommend, if we pass this today, as it ought to pass, that it go on the table for inclusion in the Senate version of the budget. And so certainly the Finance Committee is going to have an opportunity to scrub those numbers.
Okay. I'll move ought to pass on the amendment.
Okay. Seconded, Senator Whitley. Any further discussion? All right, Senator Avard.
Yes.
Senator Gray.
Yes.
Senator Whitley.
Yes.
Senator Sherman.
Yes.
Okay, the amendment has been adopted. Is there a motion of ought to pass as amended?
Second.
Moved by Senator Avard, seconded by Senator Sherman. Senator Avard.
Yes.
Senator Sherman.
Yes.
Senator Whitley.
Yes.
And Senator Gray.
Yes.
And I vote yes, too. I don't think this should go on consent.
I'd like to take it out if that's okay.
Kevin, I was going to let you take it out because you've worked on this too, but do you want to defer to Tom?
I'll defer if he cares to. I mean, this is something we worked on last time I was serving, and we worked hard on it, and I'm glad it's just moving forward. I don't care.
Actually, if Kevin wants to do it, that's fine.
No, you're fine. I don't mind. Go ahead.
All right, let's fight about it.
We'll play
Right.
guitar. We'll have a dueling guitar over it.
Yeah, there you go. Senator Avard, you get the honors on this one. I know that Senator Sherman will speak. Knowing Tom the way we know Tom.
Right.
Okay. Let's give me 1 second. All right, discussion time on Senate Bill 149. This bill had a lot of moving parts. Senator Ward's nursing home standards, Senator Rosenwald's Medicaid spend down, Senator Waters' overdose prevention, Senator Carson's pharmacy, my rehab pilot program, Senator Gray's health facilities, and Senator Guida's information sharing. So the only two sections or three sections that I'm aware of that don't require amendments, I believe, are sections 1, 2, and 7.
I think,
Well,
I think we have a request to amend 7 too.
Was there?
Yeah. I believe that came from the hospitals.
well,
Can we put that up, Griffin?
1 second.
I only got one amendment here.
There are
I'm sorry,
several
I'm put-
amendments to this. We're not going to exec it today. I'm just trying to get a clear picture of what we're doing so that we can assign people to get the amendments for the different sections.
so just taking it in turn, the first part, we heard from DHHS that it's just impossible to execute. So I'm just wondering if we want to talk about, a possible amendment to remove that portion.
That would be an easy amendment to do. I would want to go back and talk to Senator Ward. That's all.
Okay.
I don't think there was a necessary amendment on section 2. That was Cindy's section.
Yep.
Senator Gray has indicated that he's discussed an amendment with Senator Waters. Do you want to talk about that, Jim?
0598 was just sent to Kirsten during the meeting. And you all will have it if you don't have it soon.
Senator Gray, was that on part 3?
Covers part 3 and part 6. Roman 3 and Roman 6.
Okay, Jim, do you want to take us to where we are in the bill that you're proposing an amendment?
Well, Senator Waters talked about Roman
6, I believe,
on the bill. And I guess that is also not supported by the governor's office. So the amendment just basically deletes Roman 6 in part 3 and renumbers the rest. And then the rest of the bill deals with the language that was derived around the liability and stuff, and getting an agreement between the various parties, including the department. And what you see there is the culmination of that. So that will give you a chance to look at it and to see what's going on. Basically, the bottom section of that is what was requested during the hearing. There's a few minor word changes up above, but you'll see those as you go through.
Okay, I think that reflects the notes that I took during the hearing. But we'll circulate this amendment, Jim, if that's all right.
Yes, sir. That's why I pushed to get it to you today so that we could talk about it.
Okay. All right. Section 4. And I don't know if some of the advocates for section 4 are available, like Henry Vayu.
He's here.
To potentially be brought in.
I can bring him in whenever you'd like, Senator.
Okay, go ahead, bring him in.
Thank you, Senator.
Hi, Henry, how are you?
Good, thank you. So if you recall at the hearing on this section, and just for the record, we represent Partners Pharmacy, which is the organization that is bringing this section in for automated pharmacy systems. They had gone to the Board of Pharmacy to get approval for operation in New Hampshire. And the Board of Pharmacy said that it's not authorized under their current rules, and they thought that it would be better if we went to the legislature to get legislative authority. So that's what was the impetus for the bill. If you recall at the hearing, no one testified in opposition to the bill. However, the former chair of the Board of Pharmacy, Bob Stout, testified that he thought that the Board of Pharmacy currently has the authority to do this. So I talked with Mr. Stout after the hearing, and we agreed, rather than the very prescriptive language that is in section 4 right now, we both agreed to some broader language. We used the state of Florida as a model, and it's very broad language that directs the Board of Pharmacy to develop the rules on this. And that's where a lot of the things that are in a granular sense that are kind of in section 4 right now would be done through rulemaking. In the meantime, Mr. Stout is going to file a formal petition with the Board of Pharmacy to request that they do it through rulemaking. Since the hearing, there have been some discussions with the board and have pointed out some areas of the statute that indicate they already have the authority to authorize this. So I would recommend that the amendment that we're going to bring forward move forward. And we also have a dual track of this petition, which the Board of Pharmacy would have to respond within 30 days as to whether or not they will move forward with rulemaking. If they do, then maybe once this gets to the House, we can take it out there. But just want to make sure it moves forward. And so I think having both the legislative language and the Board of Pharmacy considering doing it on their own is probably the best route to take to keep the thing moving. I was contacted by CVS also, Jody Grimbliss and her client, and she had a couple of suggestions for the language, suggestions for the broad statutory amendment that we're bringing in. We had no problem with that, so CVS will be okay with it if we get that language in there. So there won't really be anyone opposed to the broad language that will get, and I can get to you, Senator Bradley and the committee.
Okay, so is everybody okay with this, what's being outlined by Mr. Vayu? And if everybody is okay with the concept, Henry, you will get me the language ASAP?
Yes.
Okie doke. All right, Henry, why don't you stay with us for just a moment?
Yep.
Because moving to section 6 of the bill, which was, section 5 of the bill. The rehab bed pilot program, I think that based on the testimony, and you represent HCA who wanted to move forward with a pilot program, that you feel you can move forward based on what Ms. St. Cyr said without this language. Is that correct?
That's correct.
So we could delete this language.
That's correct.
Okay. All right. Thank you, Henry.
Thank you, Senator and committee.
Okay. Part 7.
Part 7, I just sent you the email that I received earlier from the hospitals saying that it was already covered in Senate Bill 45. I did not check with Senator Gaida to make sure that he was comfortable with that, but
all right,
I did retain it and make sure that we did talk about it today.
All right,
We did
so
hear from Senator Rosenwald. Senator Rosenwald testified at the hearing that Part 7 tracked her amendment to SB 45 that we already passed.
Right, and they work together on it. So Gaida and Rosenwald. So Griffin, can you just double check with Senator Gaida on part 7 if it's okay to delete it?
On a hunch, I actually just got off the phone with Senator Gaida. He's fine with removing part 7.
He's fine with removing it?
Because it's basically already in Senate Bill 45.
Exactly.
Yeah,
Okay.
so he's good with getting rid of it.
All right, so it would appear that the consensus is, and I want to talk to Senator Ward about number 1, Rosenwald section as is. Senator Gray has an amendment on sections 3 and 6, which we'll distribute. We will get the language on section 4 from Mr. Vayu, section 5 and 7 will be dropped. Okay. And I will, I think Kirsten, you have all the info. We'll prepare an overall amendment.
Senator Bradley.
Yeah, Tom. Yeah.
Yeah, I completely understand Senator Ward's, what's driving part 1. I get that. One of the things that maybe if you're going to be talking to her, federal law with Medicaid reimbursable senior residential facilities, federal law requires that the state have an ombudsman for the elderly in those facilities. New Hampshire has it. Every state has to have it. So I don't know if that would be somewhat reassuring for her, especially if this is a constituent bringing this forward.
Well, I think it's the same bill that we heard 2 years ago.
Right, it is, and I think we re-referred that or did something like that with it, or perhaps not tabled. But the point is that if it's a constituent concern that was brought to her, a lot of people aren't aware that federal law requires an office of an elderly of an ombudsman for the elderly, for specifically to address these concerns, and so that might be somewhat reassuring to her if she.
Okay. All right. So I think we know where we're headed on 149. We'll take action on that next week, I think. Unless I've missed something. The last one is 162, which is the department's bill, which I sponsored. So subsequent to the hearing, my phone rang off the hook last week. And I've asked everybody except Senator Sherman that was bringing issues about this bill to try to work them out. The department is, John Williams has taken this on as a major task. Let me just go through where some of the pressure points are. Section at the bottom of the first page of the bill, section 5, having as part of licensure, certified emergency services. The Hospital Association had a problem with that. Hopefully that can be resolved, because I think the department has made a pretty good case that these services are needed. Whether it should be a condition of licensure, I think, is the issue. On page 8 of the bill.
Senator Bradley, on that last point, you remember we talked yesterday about whether it would be beneficial. Remember the concern about the lack of reimbursement by carriers for ER boarding costs.
Yep.
That was the intent of SB 11, and the report by the hospitals has been that the reimbursement is sub-Medicaid. So we just discussed the idea on that one of having a fee schedule for ER boarding costs that would also support the hospitals in the requirement of having mental health services available in the emergency room. So I just wanted to.
Well, I think that's an issue that we need to flag, whether we can do that in this bill without a hearing.
Completely understand. You just asked me to bring it.
Yeah, no, that's right. And I do think that, you know, the efforts that you, Senator Whitley, and myself have, and that's certainly a discussion item. I think we'll have plenty of opportunities to address that, you know, later in the session as needed. Okay.
Yeah, and I'll bring Senator Whitley up to snuff on that.
Yeah. Okay. All right. The next section that was problematic was section on page 8, section 36, the community mental health centers mandated transitional housing. Obviously, their rate issues. Same thing. I've asked John Williams to try to work it out with the community mental health centers. Let's see. There were on page 23 of the bill and page 35 of the bill. Marissa Chase had raised questions. Let me try to find it about, if you look on page 23, the qualified immunity, willful and wanton misconduct. I think they're proposing it should be a negligent conduct standard. So I think that's a change that probably needs to be made, both on page 35 and page 23 in section 70 and section 51. I think Senator Avard, you had a significant question on, I'm trying to find it here in the.
It's not even a question. It's just absolutely not going to go along with it.
Okay, so your item is number 51, the interstate compact for placement of children. Have you had a conversation with John Williams yet?
I've been going back and forth a little bit, texted with him. He appreciates my open mind. But this is one area where I just don't believe that we need this, and I don't want the state being able to traffic children across lines. So,
okay, so
I'd like it struck.
My understanding, and this is why I think you need to talk with him, is that if you look on page 12, line 3, this is a repeal and reenactment. So current law already exists on interstate placement. This just rewrites it. So please have that discussion with him. And let me see if I can find the last section that has been brought to my attention by Sarah Aiken of Community Bridges, and I've reached out to Mike Skibby. I apologize. It deals with DD Services. Griffin, maybe you can find it. Help me find it. DD Services between 18 and age 21. Here we go, section 62. Okay, so at any rate, I've asked the two, Mr. Skibby and Miss Aiken, to try and find a consensus on that section. Those, I believe, are.
Can I speak to that issue?
Yep, except for one other issue, and then I'll get to you, Senator Whitley. Senator Sherman had a very small change on the medical marijuana section, which you emailed me about.
Oh, right.
And I haven't forgotten it, but
yeah, it's just that
right off the top of my head.
Right, marijuana is not an opioid. So it said in medical marijuana, it said something like other opioid. I don't have it in front of me. Other opioids. Marijuana is not an opioid, but what opioids and marijuana have in common is that they are controlled substances. So the wording I sent you, Senator Bradley, used other prescribed controlled substances or prescribed controlled substances, because medical marijuana is not prescribed, it's authorized or it's certified.
Yeah, this was one I didn't even think that we needed to discuss with the department because you're right. So, Tom, if you could just make sure to email that language change to Kirsten for an amendment, that would be great. Okay. Now, Senator Whitley, section 62.
Thank you. So this was a section about services for children, essentially with developmental disabilities. This is an important issue that's been a gap for families, children and families with disabilities for decades, for a long time. It's this cliff for when children graduate from high school, for when they start getting adult services. So these are our families that need significant support. And so clarifying this is incredibly important because it's the intersection of state law and federal law with Medicaid and special ed. So clarification is very important because we don't want these families without support for 3 years.
Okay. Griffin, could you bring Sarah Aiken in? I think she is on this call, on this Zoom.
Good afternoon. This
Hi,
is Sarah
Sarah.
Aiken. How are you?
Good.
So I'd like to speak to your point, if I could, Senator Whitley. For those of you who don't know, and for the purposes of this discussion, my name is Sarah Aiken. I work for Community Bridges, which is one of the 10 area agencies that support people with developmental disabilities in New Hampshire. And I've been working on this issue now for 3 years. Excuse me. What I can tell you is that this is a bill that came forward in 2019 at the request of the Disability Rights Center due to an ongoing discussion that they had been part with the department. And I think it's really important to make a clear distinction. These children are being served already. They are being served on the in-home support waiver. They are being served on family support, and they also receive services through their school system. So in this provision, the way that it's written currently, it states that if a child, and I use the word child, but they are technically adults, they are 18 to 20-year-olds. If an individual at that age is still in school, we offer, like I said, family support and in-home supports. So they do receive a budget. The budget, however, does not cover housing because the in-home support waiver is made for children, and the assumption is that children live in their homes with their families. This provision is an important one for us to discuss, but it is vital that we understand that there is no infrastructure currently available to provide these services. This would be an entirely new addition to the disability waiver. So currently, children who exit school at any age are eligible to receive services on the adult waiver. But if you are still in school, the current provisions allow for you to have a budget, receive services in the home. So we're talking about a group of kids who are either choosing to live independently or with some kind of provider, or their parents are choosing that they no longer can house them for whatever reason, and that they're making the choice to keep them in school, but to have someone else provide their care. And while this is a very laudable goal, there is no infrastructure right now to provide those services. Are far and few between. They We have 9 group homes that serve 27 people. My organization serves over 1,300 people. So you can get a better sense of just how few people there are that we are serving in our group homes. And they are typically folks who are either elderly and medically frail, or they are forensic folks, folks who have been through, or at least in part been through, the justice system, and have, for whatever reason, are not in, they're not in prison, or they're not in jail, or, you know. And so I just want to caution you that there is no money in the budget currently for this program. And there is no infrastructure. So what I would really like to suggest is that we work together. We had an amendment that was passed last year by this committee, or introduced by this committee into this committee. And what it does is it gives us an opportunity to work with all of the partners, including the DRC and the department, to study the issue so that we know exactly how many people we are talking about, how much money it's going to cost, and to offer us a plan to develop a strategy to do this, because it's just not something that we have an infrastructure for. So for those reasons, I think we have a long way to go before we can make this before we can codify this into law. We have a lot more information that we need. And that's kind of where I'm at.
Okay,
Can I ask
couple of quick questions.
Yeah,
Yep.
so the children that I'm thinking of that fall into this hole are the ones that may graduate from high school before they're 21, but then wouldn't be eligible for services under the DD waiver for 21, and sort of filling that gap. So certainly
So that's already been done.
Okay.
So it currently in law now, and I apologize, Senator, I didn't mean to interrupt you. That is currently in statute now, that if a child leaves the school system, and for whatever reason, they graduate, they get a certificate of completion, they are then eligible for waivered adult services. But we're talking about specifically children who are not leaving the school system in this language. So the language that you're concerned about filling that gap already exists. That was put into what was House Bill 2 years ago.
Okay, great. So I think on this issue, this narrow issue, so that helps a lot, Sarah. Thank you for that clarification. If the Disability Rights Center is on too, it would be important to hear from them, I think, just while we're talking about it.
Okay. I don't know if Mr. Skibby's on the Zoom. That's why I've asked Ms. Aiken and Mr. Skibby, obviously Senator Whitley, if you want to, take it upon yourself to participate in those discussions with them, that would be great. Okay.
I believe we're going to speak this afternoon, Mr. Skibby and I, but we can certainly reschedule that, Senator, if you'd like to join us.
No, that's fine. Thank you. It looks like Mr. Skibby's on right now.
Yeah, okay. Well, in fairness, we can't go too much longer, but we'll give Mr. Skibby a minute or two.
Thank you for the opportunity.
Yeah, thanks, Sarah.
Good afternoon, Mike Skibby from the Disability Rights Center. Thank you, Mr. Chair. So this is an issue, as Sarah described. There's 2 categories of kids between ages 18 and 21, those kids who are in school and those kids who have left school, who would otherwise be eligible for developmental services. Our Medicaid waiver for this population covers this age group. There's no question about that. And so what changed was not the statute, but the department recognized that the statute and the waiver covers children who have left school, and they modified their regulations and gave guidance to the area agencies to that effect a couple of years ago. So that all that remains in terms of the coverage gap are those kids who are still in school. And so it's our opinion that the law covers this group. The department disputes that, and we've ended up in court a couple of times. This week, a Superior Court judge agreed with us and ordered the department to cover someone who's 19 years old and is still in school. And we hope that that will become the practice. But we think that the statute ought to be clarified. We think that the statute ought to make clear that the 90-day time limit for providing services applies to this group as well. And I think that in terms of an infrastructure, I mean, these are the same kids who, regardless of whether they've left school or remain in school, between ages 18 and 21. And so it's not a different basket of services that is needed. If there's an infrastructure gap, it exists for the people that are already covered, and we ought to fill that gap. We're not talking about very many kids. My office represents a kid every year or two, so far successfully, and it doesn't make sense to continue to have this uncertainty exist. This is not a group that is mostly forensic kids who would otherwise end up in the criminal justice system. These are kids who are severely disabled, eligible for developmental services, and are appropriately served and will be served once they turn age 21 in any event. If you think about it, what we're doing with the current approach to things is we're creating an incentive for kids to leave school before they're ready to leave, just for the sake of getting the services that they and their families need. And it makes no sense to create that incentive. So I'll leave it at that. I know that you have time limitations, but I think that this is an appropriate section to adopt as well.
Attorney Skibby, can you
Okay.
send us that recent court decision if you could?
Sure.
All right, so again, I think Ms. Aiken, Mr. Skibby, and, probably Senator Whitley will get involved. See if we can find a resolution to this issue, okay? All right, the last issue that I'm aware of, and maybe Griffin, you can bring in Henry Vayu again to talk about EpiPens and camps. And I believe that is in the bill on page 30.
Yes, I think it's sections 56 and 57, and represent the New Hampshire Alliance of YMCAs. And this is a camp issue, a summer camp issue, really. Also work closely with Pericles. He represents the Camp Directors Association. So all the camps are basically in the discussion on this. And I want to thank John Williams and Melissa Clement over at the department for continuing to talk to us about this issue. They've been very cooperative, and we hope to find some sort of resolution to this. So that language that's in there right now, it deals with EpiPens and auto inhalers for kids that are at summer camp. There's already been language in the statute regarding the availability of EpiPens and auto inhalers for kids that need them. And in speaking with the department, there was not an incident that drove this language. It was basically an inspection of a camp and the question of where the auto inhaler was, or the EpiPen, and I think the response that was given was not to the satisfaction of the department. And so I think they wanted to tighten this language up a little bit. Summer camps, the regulation of summer camps, if you recall, 2 years ago, your budget transferred the regulation and oversight of summer camps from the Department of Environmental Services to child care licensing over at DHHS. Part of this dynamic that's going on, I think, is both parties getting to understand each other. Child care licensing has not regulated summer camps in the past. I think they're getting to learn a lot about them. When you think about a child care facility that is probably in one building, and then you think of a summer camp, which there are some of them that are 5 miles in area, the dynamics are a little different. So we are talking with the department about the language. The current law says it's either got to be in the nurse's station or in a similarly accessible area. That's what we've been operating under all these years. The department in the language that's in the bill today says it's got to be immediately available. And the word immediate brings some liability with it, which I think has our folks concerned a bit. So we're trying to talk about the different scenarios. We both have the interest of obviously making sure that the auto inhaler and the EpiPen are in an area where they will have, the intended result of saving a kid's life. And again, there has not been any, in all the years, there's not been an incident with an auto inhaler or an EpiPen where there's been a very tragic result. So it's not, this language is not to address any of that. It's, I think, the department's interest in tightening it up a little bit. The language that they're proposing is currently in the child care licensing statute, and that's why they're proposing to put it in the summer camps. But again, summer camp in its operation is a lot different than a child care facility. They're similar, but they're different. Senator Sherman and I had a discussion the other day. He brought up a very good thought, and we're going to talk with the department about looking how it's treated at boarding schools, because boarding schools, I think, are a little more similar to camps in terms of the area, that we're talking about. So, in some instances, if a kid's been on one of these for 10 years and the parent is confident that the kid is not going to lose it, that's the appropriate place to have it, on the kid at all time. If the kid's been on it for 3 months and is just getting the hang of everything and is going to lose it, having it immediately available on the kid is not the appropriate place to have it. And then with summer camps, some of the staff are like 3 years older than the kids. They're 18-year-olds. They just graduated from high school. And so I think we have to look at, where's the right place to put it, where it's going to be there when you need it. So you're not giving it to someone that's going to lose it. So we're working this all out.
Okay.
We hope to have language, and that's it.
All right. So thank you, Henry. It sounds like you can work this out. Good job. All right. We're getting right about the witching hour here. So I've suggested to everybody that, and some of whom you heard from today, some of whom are trying to work this out, that by Friday we have submissions of draft amendments that Kirsten can put together into an OLS amendment to circulate before our hearing, our exec session next week.
Mr. Chair.
Okay. Yes.
Super quick on the EPI issue. There's a separate reference to recreational camps, line 19, section 70. So I just want to make sure Henry's aware of that. If he is going to craft an amendment, you may want to look at that line, section 70. I don't know the page number, but it's line 19 in section 70.
Okay. All right. Okay. So we have, just to recap, we have Senator Sherman's bill. We don't have to exec on that right away. Which is 75. We did Senator Prentice's bill. No, Sherman's bill is 74. We did Prentice's bill. We're going to go on that. We did, so we have 149 and 162 that have to be exec next week, and 159 that has to be exec next week. 156 doesn't. Okay, so Senator Sherman's bill, Senator French's bill do not have to be exec next week, but the other bills do. Okay. I told Kirsten that I think 9 o'clock will be fine. Is that all right with everybody? Okay. We good?
Motion to move on.
Senator Avard? He moves so we come out of exec.
Second.
Seconded by Senator Sherman. Senator Gray. Senator Gray votes aye. Senator Whitley.
Yes.
Senator Avard.
Yes.
Senator Sherman.
Yes.
I vote yes. Senator Gray moves adjourn.
Yes.
Seconded by Senator Avard. Senator Gray.
Yes.
Senator Whitley.
Yes.
Senator Sherman.
Yes.
Senator Avard.
Yes.
And I vote yes. Okey doke. We'll see you all tomorrow.